Ready? Okay. I would like to call the meeting to order for July 29th, 2020 for the Deschutes County Board of Commissioners. Please join us in the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we do have citizen input this morning, and I will address that at this moment. We have an email from Doug Horschak. His subject says, reinforce and reinstate your order to stop short-term rentals. And also he said mask mandates won't work unless they are enforced. So the important paragraph from this letter is, it is time anything and everything on the grounds of Sun River wears a mask. It is really simple. We cover our bodies. Why not carry a mask around our necks and pull it up? Deschutes County Commissioners allowed the short-term rental program being enforced in Sun River to expire. To the best of my knowledge, 90% or more of the full-time residents living in single-family dwellings are wearing masks outdoors and indoors, such as grocery shopping in Sun River. So we did let that expire in May, and he believes that it is important. The owners full-time living in single-family dwellings have spelled out this plan, and they would like this order reinstated as soon as possible. To be clear, no other Sun River owners are involved in our legal proceedings at this time, but they have been copied in the memo. So thank you, Mr. Horschak and Tina, for sending us this information regarding short-term rentals and mask, that people actually need to do that in Sun River. I believe that was our only public input for this morning's meeting. We now have our consent agenda, unless you had any comments to make this morning, Commissioner Henderson?
No, I don't have any comments. Thank you.
Okay, we do have Commissioner DeBone on.
Yes, I'm here.
Okay, good morning, Commissioner DeBone.
Good morning.
Nice to see you. We have our consent agenda. We do, I believe, need to remove item number 11 and reconvene as the Black Butte Ranch Service District in order to accomplish that appointment. So that's my only comment.
So then I'll move approval of items 1 through 10 on the consent agenda.
I'll second that.
Any further discussion? Commissioner DeBone?
Yes.
Commissioner Henderson?
Yes.
And the chair votes yes. So now we will take the, we are going to, at this moment, reconvene as Black Butte Ranch Service District. And we have an appointment to make, Jeff Swan. So is there any discussion?
No, I'm in favor of the appointment. So I'll move approval of Jeff Swan to the Black Butte Ranch County Service District position number 2 through June 30th of 2023.
And I'll second it.
Thank you. Further discussion? Commissioner Henderson?
Vote yes.
Mr. DeBone?
Yes.
And the chair votes yes. So thank you very much. We will now reconvene as the Deschutes County Board of Commissioners. We have item number 12 on our agenda. I believe we should have Molly Darling from Behavioral Health Program Manager to present the Telecare Mental Health Services document. Molly, are you available?
I am.
Oh, thank you. Good morning.
Good morning. For the record, I'm Molly Wells-Darling, Program Manager of Intensive Adult Services for Health Services, and I am here for the consideration of board signature on document 2020328, which is our contract with Telecare Mental Health Services of Oregon. This contract is for these services provided through 3 different telecare homes. So we need to adjust this on the background and policy implications. There's an error there. It identifies one of our telecare residential homes, which is our SRTF, that provides services for up to 16 individuals. We have 2 additional telecare residential facilities that provides services for a total of 10 individuals, so 5 each. So it's just an additional 10 people. It doesn't impact the maximum compensation, but I just wanted to make sure that that was in there. Telecare provides services for our individuals who are acutely and severely mentally ill, who have been either at the state hospital or we're trying to keep from going to the state hospital, and they will go into one of these levels of care. This particular contract provides the pass-through funds from OHA through us to telecare for individuals who are indigent, receiving housing in one of their facilities. So they invoice us when they have an indigent individual there. We then invoice the state. Once we receive the funds from the state, we then pay telecare. This particular contract also covers our psychiatric security review board individuals, who are people who have been found guilty except for insanity, who have gone to the state hospital and are there and then transition back out through one of our facilities. Maximum compensation for this is $300,000, and again, we just pay on this on an invoice basis once we received the compensation from OHA.
So Molly, this actually takes care of 26 people then, annually?
It's 26 beds, but it's only our indigent people who are in these facilities. So what happens is that if someone goes into the state hospital or sometimes into jail, they will often lose their Social Security, Oregon Health Plan, and all of that. And so it takes a little bit of time to get that funding back in place. So during that gap time, the state will pay for their care in the facility. So for instance, we have 5 individuals right now that we are invoicing the state for and then paying telecare.
Okay, so it's more complicated than, yes, to fit everything in.
Yes, it's not for every individual, only those that are indigent and don't have coverage, and then we work quickly to get them coverage.
Okay.
Is this consistent with what we have done in prior years?
Yes,
I was thinking.
exactly the same.
So I'm supportive of this and would move approval of board signature of document number 2020-328, Telecare Mental Health Services of Oregon, unless.
And I'll second it.
Any further discussion? Molly, I just have a question. Are the other 2 facilities, are they in Bend also, or are they elsewhere in the county?
They are. All 3 facilities are in Bend.
All of them, okay. Okay, Commissioner Henderson?
I vote yes.
Commissioner DeBonne?
Yes.
Okay, and the chair votes yes. Thank you so much, Molly. Thanks
Thank
for
you.
being with us this morning and for all that you do.
Thank you. Bye-bye.
Bye-bye. Okay, the next item on our agenda is the consideration of second reading for our housekeeping amendments. Zachariah Heck?
Good morning, Commissioners.
Good morning, Zachariah, and I know we're going to be talking to you a couple times this morning, but I do want to acknowledge you've been a tremendous asset for Deschutes County workforce, and we are going to be missing you. So I just wanted to say that right now. Thank you for all the work that you've done. It's really been a pleasure having you part of the team. So I know you'll go on to do really great things.
Thank you,
I'll
Commissioner.
just,
I appreciate that.
I'll join in that. We've enjoyed having you, your presentations on quite a few substantive things in the 3.5 years I've been here, and I wish you luck in your new endeavor.
Thank you.
But I'm sure this has been some great experience. Deschutes County can be the center of the state for some of the land use issues that happen. So it's been a great opportunity to see the big picture and some of the land use you've been involved in. So thank you very much for your service.
Absolutely. Yeah, thank you. It's been my pleasure to to work here at Deschutes County. It's a great team, great organization, and we certainly appreciate your support and working with you, the commission, the past several years. So, with that, the first item on that I'm here to discuss with you is consideration of second reading on ordinance number 2020-007, the housekeeping amendments. The board held a public hearing on July 15th concerning these amendments. The amendments, a quick overview, correct minor errors, and incorporate updates from rulemaking at the state level through amendments to Oregon revised statutes and administrative rules. On the 15th, the board closed the hearing and voted in favor of approving the proposed amendments as drafted and conducted a first reading. And so we scheduled today's agenda topic 14 days later to go forward with second reading. So here to answer any questions if any have come up in the past 2 weeks. But that's where we're at today.
Thank you.
Does this take a motion to do the second reading then? Okay, so I have no comments. Maybe Commissioner DeBone does. But.
Commissioner DeBone, do you have any comments on this?
Just making sure that it hasn't changed from the first reading. So sometimes there's Scrivener's errors or changes that might be included.
I don't believe.
No changes.
No changes.
Okay.
Great.
Yeah, well, with that, I'll move second reading of ordinance number 2020-007 by title only.
I'll second that.
Okay, further discussion? Commissioner DeBone?
Yes.
Commissioner Henderson?
Yes.
And the chair votes yes. Second reading by title only, an ordinance amending Deschutes County Code Title 9, Public Peace and Welfare, Title 15, Buildings and Construction, Title 17, Subdivisions, Title 18, Zoning Ordinance, Title 19, Urban Area Zoning Ordinance, Title 22, Procedures Ordinance, and Title 23, Deschutes County Comprehensive Plan, to incorporate changes to state law and provide clarification of existing regulations, procedures, and policies. So we have our second reading, and
Don't we now move approval?
do we need approval of that?
Of the ordinance itself?
Dave, we can't hear you?
Sorry, the motion now would be for adoption of ordinance 2020-007.
I'll move adoption of ordinance 2020-007, housekeeping amendments.
And I'll second it.
Further discussion? Commissioner Henderson?
Vote yes.
Commissioner DeBone?
Yes.
And the chair votes yes. Approval of ordinance number 2020-007, housekeeping amendments. And I don't need to read the whole title again, do I?
No, you're done.
Thank you very much, Mr. Doyle. Appreciate that. Thank you, Zachariah. Okay, so now our next item on our agenda is deliberations concerning the historic preservation amendments. Zachariah, it's your project.
Yeah, thank you.
Here we are.
Here we are again. So, the Board of County Commissioners held a public hearing on amendments to the Historic Preservation Ordinance on July 22nd. These amendments update our Historic Preservation Code, Chapter 2.28, and the Comprehensive Plan. On the 22nd, a week ago, the board closed the record at the end of the meeting, and staff scheduled this meeting a week later for deliberations on the proposed amendments. A quick overview of the proposal. The amendments do not expand or take away protections beyond what is required in state administrative rules. The amendments also do not necessarily make it easier or harder to list a historic resource on the county's Goal 5 inventory. They simply just sort of change the process and the designation or the categories, if you will, which I'll explain in further detail in a moment. And the amendments, to be clear, do not include any proposal to expand protections or to bring in a new site into the county's Goal 5 inventory outside of what has already been recognized or exists today. On that note, I wanted to follow up on something that Nick Lilac and I and Commissioner Henderson talked about between this meeting and the last meeting, and that's clarification on our comprehensive plan, section 5.9, that lists the inventory of our historic resources. So sites, and this is reference packet page 230 in your meeting packet. So sites 1 through 35 already exist in the comprehensive plan. Those are our Goal 5 local inventory. It's been practiced ever since we've had the historic preservation ordinance for several decades now, that we also, Deschutes County also provides protections to sites in Deschutes County that are listed on the National Register of Historic Places. And those are identified in the other categories on packet page, I think 231 or so, sites 37 through 48. And so these amendments make it clear that our county code, as required by the state, has procedures and protections for these National Register resources, even though they aren't technically on our Goal 5 inventory, like sites 1 through 35. There are procedures and protections for National Register sites in Deschutes County. And so the reason we're bringing in sites 36 through 48 is because of state rule. It requires us to acknowledge the National Register sites, and for the sake of ease of understanding and reading, in the code it identifies these sites rather than just referring to a list that is maintained by the state or the federal register. So that's why we're bringing them in. There's 2 different categories of the National Register sites. There's those listed prior to February of 2017, the date of the OAR amendments that we're proposing to reflect in our current code, and those sites listed after said date. And so the majority of them, 11 of the sites, fall in that list or the category prior to the new amendments. And so they receive the full suite of protections that our local inventory receives, as reflected in today's status quo. The only site that was listed after the February 2017 date is the Central Oregon Canal, and that's site number 48 in our comprehensive plan. It was listed in, I believe, March of 2019 of last year. And the only difference here, and again, mirroring what state rule allows or requires, is that sites listed after February 2017 that are not listed on the local inventory cannot, any sort of alterations to those sites do not need to go through a local process or a local review. Demolition and relocation requests are required to be reviewed per state statute by the local authority, but other than that, it's alterations are not required. The full suite of protections, alterations, demolition, relocations are provided to our local inventory, as well as our the comprehensive plan, or the National Register sites that were listed prior to 2017. And again, that's status quo. That exists today we aren't proposing to change that, and would have to go through a separate process for each site if the commissioners were interested in changing that. So I hope that clarifies some things. I can answer any questions if there are on that. The last thing I want to mention before we open up to questions from the commissioners is that in my memo on packet page 230, Commissioner DeBone threw out the possibility of amending the proposed amendments to add clarification from my understanding. So in section 2.28.140, enforcement of state preservation laws, it reads, or subsection C reads, applications to alter, relocate, or demolish a known archaeological resource shall be forwarded to the state archaeologist for comment. And then this is the change. If the state determines, that's the proposed edit, or the proposed edit by Commissioner DeBone, a local review is necessary, Deschutes County shall follow section 2.28090 and 2.28100, depending on the nature of the request. So that is a discretionary amendment. We spent some time discussing it last week, and one idea Commissioner DeBone had to make it a little more simple or straightforward, I believe, if I understood his suggestion, was just to add that if the state determines a local review is necessary. So I added that in your memo as a talking point. And with that, here to answer any questions or help facilitate the deliberations however I can.
So, Zachariah, after our meeting, I hadn't had a chance to look at the provisions again, but, my concern was I didn't want to step ahead of the state, and I guess really what we're doing is just we're incorporating what the state rules are. And we talked about, with both you and Nick, where that was actually stated in the revisions that this, changes were made in 2020 that bring our code into compliance with the state of Oregon's code and gives better notice, because I talked a little bit with them about the idea that some of this is more aggressive than what I would maybe want to have in the local code if it was just up to us. So is there somewhere we can do that? I mean, say something to that effect?
Yes, we absolutely can. And what I would sort of point the board in direction to is probably within the comprehensive plan and packet page 237, where we talk about the background of cultural and historic resources. And so somewhere in the background, we could add a sentence or a paragraph describing that these amendments, if moved toward adoption, as adopted in July of 2020, the county commissioners approved of these amendments to reflect state requirements, or something along those lines.
Yeah,
But
that sounds good to me. Now, that's in the comprehensive plan. Does it need to be in I think of the code is the more specific stuff. Does it need to be in both, or?
Well, it certainly could. So two things. It could be provided in the code itself. So that would begin on packet page 252. Perhaps we could amend the purpose statement.
Maybe add a third point on the purpose, the C.
Yep.
Said something like that.
Something.
I just would like to do that because we talked at length about, if if we didn't do this, then people would look at our code and they wouldn't know about the state code. So that's really why we're doing it, rather than debating what's the state code is, which has already been in place, I guess. So I'd be in favor of both of those.
Okay, and if I may just add one other thought, or thing I want to bring to your attention, packet page 240, section 5.9 of the comprehensive plan. This is what I was thinking of earlier. We did amend or propose an amendment, an extra sentence in the background that reads, in 2020, Deschutes County's inventories were updated to comply with Oregon administrative rules, historic resources, or Oregon administrative rule, and provide the citation, and then state OAR 660-23-200 was amended in 2017 to hopefully, our attempt of recognizing that this is why we're doing these changes. But staff can certainly add in further amendments to make it clear that why we're doing these amendments, and that our county code is required to reflect the latest requirements in state rules.
So the state actually did it in 17,
Correct.
and we're now doing it in 20. So
Yep.
this is good.
One note I'll mention, one of the reasons why it's been approximately 3 years since we're amending our code is the two things. One, waiting for our certified local government grant to help pay for staff's time in processing these amendments. So that began. We were approved to do that at the beginning of last year, and then it wasn't until October of 2019, approximately 9 months or so ago, the model ordinance came out from the state that really helped staff, provide us direction on how to implement the new OER changes.
Thanks for that clarification. That makes sense then, and now we're actually pretty much on top of it if the model didn't come out, or the memo from the state.
So I like the idea of adding a sentence probably in that background section 2.11 on page 237, just talking about that exact statement, the fact that the state updated it. There's model ordinance. It was an effort in 2020 to get this through, which is a little different than the section 5.9 statement, which just talks about specifically inventories updated.
Okay.
So then Commissioner Henderson, you mentioned another one in the code itself. I guess I didn't follow that.
It's right at the start of 20, it's on our page 252. There's a purpose section, I'm just adding another
In the code.
C, in the code that would say kind of the similar thing that.
And I don't know that, I'd rather have the code pretty black and white and then reference back to the comp plan for the bigger picture is my conclusion.
My only thought with it was that if somebody goes to the code to see what the rules are, they may not know to connect it to the comp plan. I'm not sure.
Maybe a reference back to comp plan 2.1
or something like
2.11 explains it.
Yeah, that was my thought, so that they know that what's here was consistent with state law, and we've said, because I don't know when people look things up, where they look, and so that was, to me, they're two different places, I guess.
So in the code, just kind of a pointer back to the comprehensive plan.
Yeah, but I think it's still what I'd prefer to call out, that it was amended due to changes in the state law, and you could say as discussed in the background section of the comprehensive plan or something. That's what you're asking.
Just a
Yeah,
cross-reference.
I'm supportive of something like that, yeah.
We had good discussions with Zachariah and Nick about just the My concern with the impact of this is that, again, the short timelines for something to be historic is really, can be used, and it actually was used in some ways to get a different objective than really the history of something. It's stated as something historic to preserve something or prevent something from happening or whatever. But I guess that's just state law, so the place to change it would be at a state organization, so. But in 75 years is the last year of World War II, and I think of everything historic as being before World War II. I mean, it's hard for me to think of anything historic since, I mean, that I want to preserve, but anyway.
So back to that proposed change in the memo, if the state determines, a question for you, Zechariah, is that the intention of that? I mean, that's the only place that decision will be made. Is that correct? The state determines the local review is necessary?
Correct.
So, I mean, it is clarity, and it's the one place that decision would be made.
Yep.
Right.
Question about that is it the state archaeologist that determines that, or who at the state has that authority?
My understanding is it's the state archaeologist, and there's a deputy state archaeologist as well, but they are staff within the State Historic Preservation Office. So I think we'd send it to SHPO in care of the state archaeologist, and how, I would imagine it'd come down from the state archaeologist, but formally from the State Historic Preservation Office.
I would accept that change as written in the memo.
Okay.
Other than that, I mean, the big picture, these are kind of another group of housekeeping amendments. You just mentioned the model code, the alignment of the state system, the state, how this all comes together. And this is getting that all realigned. So we could almost think of this as another housekeeping amendment package.
Yes, absolutely. I agree with Commissioner DeBone. Again, you look through the full amendments, and there's a almost a strike through or an underlined section that changes the code throughout the entire chapter 2.28. But as I tried to explain in the public hearing, the reason for that is you change a few definitions, and it just has ripple effects that go throughout the whole code. I mean, we amended, I think it was, we took out object or building because structure, it was just redundant because structure was already in there. And so to be consistent and to make sure there weren't any holes in the code itself, I went through and made sure it was tight throughout the whole code. And that's why there's a lot of red in the amendment.
I know that we have Nick in the room. Nick, did you have any comments you wanted to make? No? Okay, great. No, I just didn't know if you were. So thank you, though, for identifying on page 229 that 22.28.090 is the most significant change. That seems to be of everything that we're looking at.
Yep, it certainly is. It changes, it takes away that the requirement for the Deschutes County to review alterations to National Register resources listed after February 2017. But again, that's not a discretionary amendment. That is a requirement for the county to implement from state rule. That said, if there is interest in providing alteration procedures and process, ultimately protections to those resources, the board can propose to add individually each one of those sites, add or bring them into our local code as well.
Thank you, Zachariah.
For clarification, Commissioner Adair and Henderson, what are your thoughts on Commissioner DeBone's proposed edit to the amendments on packet page 230 if the state determines adding that into the amendment?
I'm fine with it. I think it clarifies the issue that we had, the questions we got about, so.
No, and I'm also,
Okay, thank you for the clarification.
yes.
So this was deliberations on these amendments, so I would move to close our deliberations unless we need to do further.
Okay, all right.
I support that.
Okay, so it's deliberations. Any further? Commissioner Henderson?
I vote yes.
Commissioner DeBonne?
Yes.
And the chair votes yes. So we are now closing our deliberations.
And I think we do a first reading.
So are we gonna,
We should
is there a
vote.
sentence to be created still?
What?
Is there a sentence to be created, a couple sentences to be created in the
Right,
kind of introductory sentences?
I know. Is that something that we need to have you do, Zachariah, and then bring it back? Or can we read it as
Good question. I can certainly, I can bring it back today if there's room on the agenda. I perhaps would look to Mr. Doyle if that needs to be done before first reading or it could be done in between. I'm not sure of the legal process there.
Okay.
But I acknowledge they're not substantive, they're introductory type statements in the background section in section 2.11, and then in the code on 2.28, chapter 2.28.
So, Mr. Doyle, what is your analysis?
Commissioner, certainly if the board's inclined to direct that addition, you could have first reading today with that noted, and Zach can make that clear at the time of second reading,
Okay,
that those changes had been made.
all right, okay. So, let's see, I believe Commissioner Henderson?
Yeah, I'll move first reading of ordinance number 2020-006.
Okay,
Title
Commissioner
only?
DeBonne?
By title only?
Oh, by title only.
I will second it.
Okay, it's been moved and seconded. Any further discussion? Commissioner Henderson?
Vote yes.
Commissioner DeBonne?
Yes.
The chair votes yes by title only. An ordinance amending Deschutes County Code Title II, Administration, and Title 23, Deschutes County Comprehensive Plan to update the county's historic resource inventory and the county's historic preservation ordinance to comply with the state's historic preservation rule in OAR 660-023-0200. So by title only. So then we will come back, what, in 2 weeks, Zachariah?
Correct.
And you'll have those minor modifications at that moment for us.
Yes, I will. I will note, just for clarification, I'll work on these amendments and make sure they're provided to you in 2 weeks. But as my last day with the county will be August
gone.
7th, Peter Gutowski or Nick Lelak will be facilitating that discussion. I'll make it easy on them, though.
Okay, please make it really easy on them. I'm sure they would appreciate that. Thank you, Zachariah, so much.
All right. Thanks for your time. Take care.
No, thank you. Okay, all right. We are now ready for our COVID update. And we do have our document, our presentation. So let's see, Nahad or Dr. Conway, who would like to open up with our presentation?
Good morning.
Good morning, Nahad.
How are you all? I'm just waiting for Dr. Fawcett to walk up the stairs. In the meantime, if it's okay with commissioners, perhaps Dr. Conway, if you're available, he can start with a brief update on the long-term care facilities.
That would be great.
Okay, let me just, sorry, we were expecting to come on in 15 minutes, so if you just allow us 1 minute, we'll gather ourselves.
Sure.
Thanks.
I'm going to take a quick break.
Okay, yes. Are we going to take a quick break off the film? No.
It's up to you.
Okay. All right, we're just going to take a minute break then?
And I'll acknowledge we have a Facebook Live opportunity right now. So for those folks just finding it, this is another opportunity to get some of the information out in another avenue. So we have our Zoom meeting and the video. So now we've got Facebook Live.
Okay. Good morning again. I think I'll get, oh, okay. Commissioner Henderson just seems like he walked away, so that buys us a little bit more time.
Thank you, Nahad. Okay. Let's see. Are we ready to? Nahad?
Yes,
Okay. Want to go ahead?
sure. Dr. Conway, okay with you to
Sure.
get started? Thanks.
Sure. I'm actually gonna open, but Nahad will do most of the talking. I'm George Conway, Health Services Director. Just gonna give a brief update on our long-term care facility outbreaks. We have 6 facilities currently that meet the state's case definition for outbreak, which means at least one ill resident or staff member. We have a substantial outbreak in one of them, which has been talked about publicly quite a bit. The update for the large one, which has been Bachelor Memory Care Facility, is now a very substantial number of infected individuals, for just under 2/3 of whom are residents that are infected and the others are staff. The most likely source of this infection, because these are the resident sides of most of these long-term care facilities are closed populations, the most likely way that these infections are introduced are by staff who are circulating and have lives out in the community and are likely to introduce this. The way that this is being managed at each of these is that there's cross-sectional testing of all staff and residents. And in this instance where we have this substantial outbreak, we will continue testing everyone weekly until we have 2 weeks where there are no more cases. Other measures that are taking place are cohorting of individuals infected versus not, and very substantial efforts to improve, although in general the hygienic practices have been reasonably good, but to improve the hygienic practices at each of these facilities. And we're receiving assistance from the Health Services Group in OHA, DHS, and also some assistance from OHA in follow-up and data keeping. I think that's about all I have to add about this. We're concerned about there being a number of these, and we're investing a great deal of time in doing our best to contain and limit those infections at the others as well.
So just to clarify, Dr. Conway, that means the other 5 facilities have 1 positive each, is that correct?
I'm just looking. We have the definition is there's 1 positive each. There are a number of tests pending, and I actually do not know the status as of this morning. As of yesterday, we did not have other infections, but I do not know as of this morning. I'm waiting to hear that information. But we are doing systematic testing at each of those other 5 facilities.
When you say systematic, does that mean you're testing all the employees and all the residents?
That's the intention, yes.
And these weren't on the original pilot testing of the 5 that the state did a couple weeks ago?
There were 5 done. I actually don't recall which 5 those were, so I cannot tell you whether or not any of these were also included in this. That was some time ago, though, so if we have a new case, we just have to undertake the same procedure for each.
Following up on what Commissioner Dare was asking, it was a little unclear. Are you saying in these other 5 facilities that have 1 case, either resident or staff, you're testing everybody in each of those facilities?
That is the protocol, to do cross-sectional testing in each facility.
And do you do it? How often do they do it?
Well, if there's, as I said, the protocol for the one where we have an outbreak is there's cross-sectional testing done weekly until we have 2 weeks where there are no residual tests that are positive, no more tests that are positive. And the same protocol would appear here. If we have just a single case, then the overall management of that there may be a certain amount of judgment, but the general protocol would be, if you have such an outbreak, you test everyone, and you do your best to contain that, and then you continue to test until you have 2 weeks where you have no longer any additional positive tests. Now, if you had 1 or 2 people, and if they were staff rather than residents, you remove them from a milieu, and then you had, even though they might still be infected, but you had 2, if you will, clean weeks of negative tests across the board, then I think then we'd revert to more normal. And normal right now, we're hoping that each facility, per the state's procedure, each facility will be testing 1/4 of everyone each week, so that monthly, basically, you're doing serial testing of the population. The intent is to do that with all of the long-term care facilities in the state one cycle by the end of September. Because we're one of the places that's now had a substantial outbreak, our intention is to do our best to do that going forward.
So these tests, how long does it take to get the results? Are they using a rapid test or not?
No, these tests are the ones for long-term care facilities. There's a separate testing line that's been set up. It's a bulk testing protocol, also being done at the state laboratory. This is a type of standard reverse transcriptase polymerase chain reaction test. The turnarounds are reasonably good if it's during the weekday, typically within 48 hours of when the specimens, and typically less than that of when the specimens are received in Hillsborough. So it depends on the time of day. If we if the VA team comes in to assist us, or we ourselves do a very major testing regime over a weekend, then we would be sending these by courier on Sunday, and very likely to have the results by no later than Wednesday, most likely sometime on Tuesday.
So the results that we're waiting for today, are they from Sunday, the testing?
There's been testing each day of a number of these. I'm sorry, I don't have that, and Ms. Coe is in the middle of something else. She's the one that would know that. She's our lead person. She's our, as you know, the regional long-term care facility liaison for the Central Oregon, and she's leading our efforts in these control measures and surveillance for each of these facilities.
Okay, all right. So thank you for that update, and if you can let us know as soon as possible regarding the other 5 facilities, that would be.
But we'll be happy to send you an update today.
Yes, that would be really excellent. We would all really appreciate that.
And actually, if I can find it out while Nahad's speaking, I'll tell you at the end of this.
Okay, that would be great. Thank you so much, Dr. Conway.
Good morning. Should I get started?
Yes, you may. Thank you, Nahad.
And I hope the slides are on the screen.
Yes, they are.
Wonderful. So a very good morning to all of you commissioners and colleagues, and also a good morning to the community, and especially my neighbors. In the last few days, we've had a number of neighbors stop by and welcome us to our new community. So we're grateful to them. And in fact, it seems like these days every conversation includes something about COVID. So they were asking me about where is a good source of information, and I mentioned tuning in to these public meetings is a good source of information sharing. So hopefully a few of them are listening in and benefiting from the facts that we are sharing and the exchanges that we're having. So my name is Nahad Sadrazudi. I'm the Director of Public Health for Deschutes County Health Services. I have with me Dr. Richard Fawcett, our health officer, and of course, Dr. Conway already introduced himself earlier. As always, I'd like to start by acknowledging our department staff from all service areas for their dedication and hard work. Also, I'd like to thank Jenny Faith, who is our epidemiologist, for the data analysis and updates. So it's been 10 to 11 weeks, so around 10 and a half weeks since we had the first phase 1 reopening. I just wanted to put that out there, that it's been almost 3 months since then. And what we're seeing is, as of, as of yesterday, we have a total of 478 cases with around 310 recovered, and unfortunately with 5 deaths. This week we have 29 cases on Monday and Tuesday as of yesterday. And in the last 3 weeks, we've had almost as many cases as we had the last 17 weeks prior. This
So
graph is the
29
cumulative
is Monday and Tuesday combined, is what you're saying?
Yes, I include the 478 include Monday and Tuesday. Yes,
Okay.
Commissioner. Yeah.
Thank you.
Now sure. This is the graph of the cumulative numbers, and as I've mentioned before, this really tells us the rate of change, which we're seeing is increasing in the last few weeks. And as I mentioned last week, this is not a second wave. I know you understand that, but I just want to make sure also the community understands that this is not a second wave that we're facing. This is continuation of the first cases that we had in our community. Just a quick age breakdown that we have talked about on numerous occasions, but it's also a good reminder to the community that a large number of the cases are between the ages of 20 to 50, and with the age category of 20 to 29 burning the highest number of cases for a variety of reasons. So this is a good reminder that everyone is susceptible to acquiring this virus. And so nobody's immune from it. So the takeaway from this next graph is that, as I mentioned in the previous one, that everyone can get this virus, the young, the old. And what we're seeing, of course, in the last couple of weeks is the outbreaks in our long-term care facilities, increasing the older age populations who have acquired this virus. Generally, the vast majority of the cases are under the age of 60. However, as I mentioned, in the last few weeks, especially in July, we're seeing an increasing number of cases in above 60, but especially above 80. This slide is, again, really giving us a sense of what is driving our case numbers. And as I mentioned last week, this discussion is important because it helps us with developing targeted policies. But fortunately or not, we are not seeing necessarily one or two drivers behind the increasing number of cases. We are seeing cases being driven through outbreaks. These are the ones we are pretty sure in terms of linkages amongst the place, the person, the time. We're seeing a number of the cases linked to clusters, so especially business-associated clusters. We're seeing a number of cases driven by close contacts. So maybe me and my friend, me and my neighbor, me and my boss, and of course household linkages is where we've seen it. Visiting our grandparents, our cousins, our parents, or living together in crowded settings and not isolating properly or quarantining properly. So we see the transmission happening amongst household settings. So really, and of course, the community-acquired and sporadic cases, which, as mentioned before, we really are not able to identify necessarily where the linkage is and where the source of infection is.
Nahad,
All of the,
I'd like to say something at this moment that I think people have forgotten. If you have had a COVID test, could you please quarantine yourself until you get the result? Because there must have been a reason why you had the test. Thank you for doing that. But also, it's really important to quarantine yourself, because if you continue to be out in the community till you get your results, you could be spreading your positivity, and we really need to have that stop. I've asked the state to repeat that message. I think it's really been lost. I know initially I believe it was in February, one of our first cases was out in the public, collapsed, and exposed so many people in that community to him and the fact that he was positive for COVID. So please, if you've been tested, stay quarantined, 48 hours, whatever it takes, but please wait for the results. So thank you, Nahad. I just really think that's important to remind people that it's a very compassionate thing to do for your surroundings till you find out what is the result. Sorry to interrupt.
No, not at all, Commissioner. Really appreciate your advice. I couldn't agree with you more. And it goes back to being Deschutes caring and Deschutes smart. So I really, really appreciate what you just said. Thank you for that. So this is a new slide coming especially from Commissioner Henderson's great questions the last few weeks around how cases are first identified it's not a perfect slide in the sense that we're still trying to understand the data better. So the way we're able to present some of the data really depend on the input of the data in the system. So we're trying to better understand it. But what we see from this slide is that this is the denominator is the cases. And what we see here is that a vast majority of or let's say a good proportion of the cases are being tested based on some sort of a clinical evaluation. And to some extent, we believe that the pre-op screening is also categorized as part of clinical evaluation. And then we see another good proportion of folks, so together it comes to around 80%, are being identified through contact tracing. And this goes really back to the great decisions and investments that this county has made in increasing the capacity of the public health department in contact tracing and investigation. So we're able to have people tested through the contact tracing investigation that we do. And then, as you, Commissioner Adair rightfully said, hopefully you get, as you're tested and waiting for the results, you pull out of circulation to make sure that you are not, or we're not transmitting the virus to others. And then there is this other 2 or 3 categories that are kind of like what we call sort of the catch-all kind of categories, where there are a couple of reasons mentioned. Maybe there was some serial testing or screening or routine testing, or maybe some other reasons, or even unknown. So, but what we see, I think the key message here is that vast majority of people are still being tested either through contact tracing or clinical evaluation. So for the next 2 or 3 slides, 3 slides, I'm going to give the floor to Dr. Fawcett, who's going to walk you through these, the testing and the hospitalization.
Good morning, Commissioners, and thank you for inviting me.
Dr. Fawcett, thank you. Can you just speak a little bit louder?
Sure, yeah. I still have, we're pretty close together. Can you, is that better?
Much better, thank you.
Okay, great. We moved the mic. Thank you for inviting me here. It's been a busy week or two, just here in the community in general. I wanted to go to looking at the weekly breakdown of the testing results again. So just focusing on the last 4 or 5 weeks, we can see that those dark bars at the bottom, which are the positive tests, they have gone up for sure. We're getting it to about 100 positive tests per week, approximately. So that does bring up our overall test positivity rate, where it used to be less than 1%, or at some point in time we got up to about 1%. On average now we're probably up to about 3%. Per week we're higher than that. So we had, as Deschutes said, 108 cases Monday through Monday. And with the total tests for that last week, that actually goes to Sunday, the 20th through the 26th, about 1,368 total tests. I'm sorry, negative tests. Excuse me. That lighter bar is the negative tests. The solid bar at the bottom are the positive tests. So slightly less total tests done if you add the positives and negatives together. The number on the top of those bars is the number of, I believe it's the number of total tests, right, Nahan? Yes. Yeah. No, I'm sorry. Excuse me. Excuse me. The number of negative tests is the lighter bar. So the number at the top of the negative tests, and at the bottom the positive tests, and if you add the two together, you get the total tests. So the test positivity rate is going up. The last 3 or 4 weeks, I think that's an important piece of data to look at for sure. Our hope is that this is going to stabilize. I'll go to the next slide. This has to do with hospitalizations at St. Charles Health System. Almost all these patients have been at St. Charles Bend, especially the last 2 or 3 months. The patients are cohorted to Bend. We did reach, since we last talked last week, up to about 16 patients in the hospital with COVID-19. We've had a few discharges, and that's down a bit to 8 or 9. I think it's at 10 today. Don't quote me on that, but it seems to be rising slowly in terms of the total numbers of patients in the hospital at St. Charles Bend with COVID-19.
Dr. Fawcett, though, that number 10 is not all Deschutes County residents, correct?
That's exactly right. Yes, that's true. So these are all patients in St. Charles hospitals, which is pretty much just Bend. But there have been days where, if you look back to earlier in July, we might have been at 10, 11 patients, and sometimes we've had half of them not Deschutes County residents. That's correct. And we are starting to track that more with the hospital. It's data that they keep and track, and it's data that we do have access here at the health department to that data should we need to access it, which we do.
See, Dr. Fawcett, this is Commissioner Henderson. So when I look at the hospitalization, it's really interesting to compare the recent rise in hospitalizations to the first mountain over the left. And my impression was that the first one, when we went back in March and April, almost all of those were from Deschutes County. Isn't that correct?
My memory was that was probably correct. Dr. Conway has spoken to this before, but a lot of what I'm speaking about is not necessarily one-on-one contact with the patient. Sometimes it's in consultation over the phone with the hospitalists and the intensivists.
Yeah.
But in the very beginning, we had a lot of travelers, and many of them were actually traveling within the United States, some out of the country. So you had folks who were fairly mobile, maybe visiting family or just on a holiday. So a lot of the patients that came in the hospital, I think, were residents. In fact, I can remember the first one or two that were not, and they were memorable because they had come, kind of like what we're seeing now. They had come in the spring to Central Oregon for a vacation, and unfortunately, hardly even had one night in Bend without having to be hospitalized. So I think that's a fair statement. Yeah,
So what I kind of look at, and from a public policy standpoint, what I worry about a little bit is just what's the message that the public is getting about COVID-19. And you're hearing a lot on the news about increased cases. And so you could look at this and say, well, there's this big uptick in hospitalization that we haven't seen anywhere near, we haven't seen for 3 months. Now it's up again. But if one was almost all Deschutes County, and then the second one, this recent one, has been, a big part of that, I think you call it cohort, is from outside. They're not apples to apples, really. So it's changed. It isn't necessarily more serious on the ground here than it was in March and April from a hospitalization standpoint, is kind of what I read this to be. That takeaway, and we'll talk about testing and positive cases in a minute, but just from a hospitalization, we're actually maybe better off, less hospitalizations than we were back then. Isn't that kind of how you read this?
Right. No, and I think, without having excellent data on this, and maybe at some point we will do better surveillance, but there is a feeling that there is a bit of a different strain that's circulating throughout the United States and maybe in Great Britain as well, that is more contagious, but maybe not quite as dangerous, not quite as lethal, as likely to cause respiratory failure. And so that's interesting. This sort of switch to this G strain. So we don't strain type this, of course, and that's why I think it'd be interesting to kind of get a sense in each state what strain is circulating. But
yeah,
I mean, for no doubt that we're seeing a lot more infection in the community in proportion to the numbers of hospitalizations. to me, that's one of the biggest factors as to why we don't have more hospitalized patients. We've never had 100 positive cases amongst county residents per week before. And if we were back in late March, early April, and we had 100 residents positive in the community per week, my fear back then was that we'd see a lot more hospitalization. And then lastly, there is a little bit of a lag. We seem to surge in our positive tests and increase in the positive test rates, and then the hospitalization seems to follow maybe 2, 3, 4 weeks after that. But I still believe that we're seeing less severe disease on average compared to what we were seeing in March and April. So I think that's correct. I think one of my concerns has been maybe just the duration of symptoms and the severity of illness of some of the folks that have been from out of town. Some middle-aged, some young, some in their 20s and 30s. And so I don't know if that's because these folks have had more exposure when they've come from California, Arizona, just a couple of examples. But I fear that there's some places in the United States where the diligence with physical distancing and masking is not really as good as it's been here in this state. And there are some people that are better, but those people don't spread the virus. Those people tend not to be hospitalized. So because it's so contagious now, I'm concerned about people coming into our community, understandably wanting to have a vacation, wanting to go out to the restaurant and be at the hotel. That's understandable. Nobody wants to have to waste their summer and their summer vacation, but at the same time, this virus is very, very transmissible. So it is a different pattern, you're right. There's probably multiple factors.
Dr. Fawcett, if I may add to this, I think Commissioner Henderson, another contributing factor could be that because we have a better sort of testing capacity in our community, we're able to catch people a bit earlier. Early on, as you may recall, people were really, really sick by the time they were being tested because we didn't have enough tests. Whereas now we're able to, especially through contact tracing, catch them earlier, monitor them, provide maybe preemptive care for them to some extent, which is also helping the severity of the disease as well. So that's perhaps another element in this.
Yeah, that's a good point, Nahan. We have some treatment now, whereas back in March and April, we really had very little. We had hydroxychloroquine, which was very experimental, which we don't feel really was very helpful. Now we have remdesivir combined with dexamethasone, so that's probably been helpful as well. So I think our test positivity rates now are higher than in even in April and March. Back then, we were seeing a few more cases in the community, but we know that even though we're testing more, that the rates are higher. We are testing, of course, more mildly symptomatic patients, even in some cases asymptomatic patients. That's true. That was not happening back in March and April. That's a good point.
But initially, Dr. Fawcett, the people that were in the positivity were older in March and April. They were definitely older. And then I believe starting in May, we flipped it, and the positive were in the 20s. So, and at that time, we weren't really sure if that's what it was going to hold to, but, definitely the age range has gone down. What is it now, from 20 to 50? The majority of our cases with 20 to 29 being the highest percentage.
You're absolutely right, Commissioner. You're absolutely right. I put the slide on for you this is exactly what you were referring to. Good memory.
Right, and actually that was the intervention I was trying to make a few minutes. The demography is probably or the age in this case is probably the easiest explanation. We have a bimodal demography now where we have a preponderance of young middle-aged adults, and then we have a large number of infected, very elderly people, not all of whom would necessarily come to hospital, even if very ill. So I think for the latter reason, we will continue to see the number of hospitalizations; those will persist, as well as deaths. But I think that's probably the overall explanation is most likely the demography or the age, as you astutely observed, Commissioner. Thanks.
I just remembered it. But my question now is, okay, so we have under 40, we have 6. Can you break that number down for us? Is it possible? So were any of them in their 20s?
We're
If
looking
we-
at the hospitalizations.
Yes.
So then now this reflects patients that have been hospitalized to date. And so if we look at the bottom graphs there, if I go to the very bottom, 60 and up, that's, a total of 26 Deschutes County residents have been hospitalized. So obviously a much higher proportion of the more elderly patients who are infected are being hospitalized versus the younger age groups. But correct, so ages 40 to 59 amongst Deschutes County residents, we have a smaller proportion that are being hospitalized. And the same is true for those that are under 40. So that's an interesting trend. In terms of sex breakdown, that's held pretty steady, a little bit more men than women. I have a feeling we're going to see that balance out. But looks like that the men are more likely to be sicker to the point that they require hospitalization compared to the women who seem like we have less hospitalization. I think the percentage there is slightly more men, total men who are positive are hospitalized versus total women who are positive hospitalized.
And Commissioner, we can definitely break that down for you. Perhaps we can do it offline. No
I just
problem.
noticed that we had 15 positives for children 9 and under, and then we've got 45 for 10 to 19. So I'm just curious if any of those have had to be hospitalized, or if they just had mild cases and recovered pretty rapidly.
Yeah, we can do that offline for you.
Okay,
No problem.
thank you so much. I just think it's important to know. Our schools, our schools are out there.
Right. I'm not aware of any pediatric admissions, at least not recently, but we'll look at that. Make sure.
So thank you, Dr. Fawcett. So in fact, as we've discussed in the past, this situation is not just about life and death. Even those who have recovered can take a long, long time to really reach their baseline health. And this is a recent study from CDC where it shows that 1 in 5 previously healthy young adults were back to their usual health within basically 3 weeks after testing positive. So there is a residual impact on their well-being even after, even without being necessarily hospitalized or dying from this virus. And so we have to always keep that in mind as well. And what we know right now is that evidence is definitely showing that masks work. So wearing masks, any type of mask, frankly, for that matter, but of course, as you mentioned rightfully, Commissioner Derek, the procedure masks are easier. But any sort of mask, any sort of face covering in the community is helpful. And it's helpful not just necessarily for protecting others, as we have talked about, but even we have noticed there is some evidence that the severity of disease in us, if we acquire the virus, is lessened, perhaps because the amount of virus that we're acquiring is not as much. So there's also positive aspects to wearing masks for ourselves. And this IHME model for Oregon, which the White House also uses, is very helpful in showing that if we continue to use masks, we can actually change the trajectory of the deaths, as well as cases in Oregon and in our community. So as I try to wrap this up, as I know you're busy today, yesterday many people may have watched the announcement around school reopening. And from a personal perspective, I believe that school reopening is important, of course, for children, but also for social cohesion, for our economy, for businesses, and in fact, for gender equality and employment. As women, as we know that women are disproportionately affected by school closures. They're the ones who sacrifice and stay home to take care of the children, and it affects, of course, their economic well-being as well. So having said that, we cannot disregard the health and safety of our children, the teachers, the administrators. So as a community, I think we need to decide on the course of action in the fall and whether or not the schools will reopen. So it's really dependent on our decisions and choices today as to whether or not we're going to have the schools reopen in the fall. So it's well within our sphere of influence and control, and well within the decisions that we are making. And to do that, for the schools to reopen, we must bring the infection rate down. That's the only way we're able to open the schools up safely, not just for the children, but for the teachers, administrators, many of whom go home to their elderly parents and spouses. So it's quite important that they're well protected. So the good news is that we can change the trajectory of this virus and infection rate in our community, and we can do so by wearing masks properly. You may recall last week the graphic I had up of the cats. I didn't put it up, Commissioner, because I was waiting for a photo of your cat to put there. But
for sure, next week I'll send you their picture in. They
Thank
would
you.
love it.
Thank you. So really, we can change the trajectory of this situation and the infection rate by wearing a mask properly. And as I mentioned, it's not just about protecting others, but it's also we have evidence that it shows that the severity of disease is lessened in us by wearing masks. We can watch our distance and reduce gathering in large numbers. We can continue to wash our hands. And I know that we're going to get through this because, as I have said in the last months and months, we're going to get through this because we are Deschutes smart, we are Deschutes united, and we are Deschutes caring. By the way, on the right, you see a graphic from Texas Medical Association that I found that I thought was kind of useful because I've had a number of folks from the community contact me and ask me like what's safe, what's not safe to do, and all that. And of course, some of this is subjective. I'm not saying we should just think of this as evidence-based necessarily, but a lot of it's commonsensical, which shows really what activities tend to be low risk versus high risk if we don't take proper action like wear masks or watch our distance or wash our hands. If we don't do that, really what is considered low risk and what is considered high risk. And whatever is in high risk area, space can also be lowered in terms of risk if we do take proper actions like wearing masks and distance and all that. So with that, I conclude our joint presentation, and thank you for your time. Thank you, Dr. Conway. Thank you, Dr. Fawcett, and many thanks to our department staff and commissioners, to all of you. Thank you.
Nahad,
Actually, commissioners, I do have a.
I've
go
got
ahead,
some questions.
So, and then
Go ahead, please.
before we close, Commissioner, I also have the updates that you asked.
Okay, so you want to give us the updates then?
Well, I'm happy to go after you if you want.
Okay, Nahad, I just calculated it. We're at like 7.3% positive for this week, the 1368. Yes. Per the governor's information yesterday, the only county in Oregon that really passes is Wheeler County, because I believe they're still at 0 for schools, and then maybe some of the other schools that are less than 100 students. Did you watch that presentation?
Yes, Commissioner, I think we all watched it. And just a word of caution on this last week, we don't have all the results in yet, and that's why it's kind of, there's that pinkish background to it, and the numbers in terms of the new, the total tests will continue to go up as we progress through the week.
Okay, well, and then my other question is, it says moderate to high risk is going to a hair salon. Well, they take your temperature at a hair salon. You have a chart in here that says 2 hairdressers worked on 139 people and no one had COVID. So if we're required to wear a mask, we have our temperature taken, everyone is social distancing, why would that still be at moderate to high risk?
No, thank you for bringing that up. In fact, that's the reason. It's exactly, the evidence shows that since they were wearing face coverings, they were able to reduce or have no infections or no transmission. So if we don't take particular actions or steps in reducing the risk, then these would be considered low to high risk. But if we are wearing masks, if we are washing our distance, if we are washing our hands, then we are definitely reducing risk, even in high risk kind of potential settings. So thanks for bringing that up.
And the other thing I noticed on the chart for moderate to high risk is flying. And I did talk to Congressman Walden about that on Saturday morning and said that I really feel that TSA should be taking temperatures because you cannot go into a lot of buildings without having your temperature taken in today's world. Why is it you can get on a plane without your temperature taken and several questions answered about your health? So I'm really hoping that TSA will put that into effect for the country and not just a few locations where it apparently is applicable at this moment. I just, I think it would make flying much safer if people had to have their temperatures taken. So thank you.
That's a good point. Thank you for that. And I don't remember, maybe it was mentioned last week. I'm not sure if I'm mixing the meetings now, but I think there was going to be a meeting around this issue, and I'm not sure if there was any follow-up, but definitely, yeah, that's a good point. Thank you.
Commissioner Henderson had a meeting on last Thursday.
Oh,
and
okay.
he was going to bring it up on Thursday, and, I talked to Congressman Walden about it too.
Excellent, excellent. Great. Thank you for following up on those issues. Thank you for that.
So, this is Commissioner Henderson. I have a few questions also. Dr. Conway, I look like from reading one of the emails that maybe you're involved in the setting of the school policy, the school reopening policy. Is that correct?
Actually, the health, so each of these policies are typically shared in draft form with a group of the health administrators.
Okay. One of the questions that I have was about schools. Is I heard on the news program last night that there was no evidence of any teachers getting COVID-19 from students in other countries or in the United States. Have you heard that before, or is that something to debunk? Or it's very interesting. It was true.
I have not heard that. The age stratification that's being used is the result of a large study that was done in South Korea involving 60,000 persons, but I don't recall any of that analysis being transmission pathways like you're asking about. So I have not heard that.
You've heard about the study, but not the result, or what did you mean?
I have not heard anything indicating what you just said, that there's no evidence for transmission from children to teachers.
So the other thing that there's been a lot of discussion the last couple of days on the news about vaccines and the rapid development of vaccines, and then also I think even Dr. Fawcett touched on it today, that the increased use of some of the I'll call them medicines, but therapeutics, whatever, to make the cases less harmful are improving. Is that what's your? Do you have any feedback on any of that? It's been a big topic in the last few days.
Sure. Well, a few things. One is that the understanding of the disease continues to improve, so we know what to look for earlier. We do have one well-proven therapeutic agent, remdesivir. Unfortunately, it's not in abundant supply, but when it's possible to use it, it does appear to shorten the course of illness. And then also, as we've heard about locally, this has been one of the trial sites for convalescent serum or plasma being given to patients that are very ill, and it does appear to reduce the severity of illness as well as shorten the course of illness. As far as vaccines go, there are 2 large vaccine trials entering phase 3 currently in the United States, each of which are recruiting 30,000 candidates. I don't know about one of them. One of them is dividing them. It's doing a blinded study comparing 15,000 individuals that are immunized and 15,000 immunized with their status. They're not knowing their status, and then looking to see if infection rates are higher in one than the other. So those 2 have just started as their phase 3, which are efficacy studies. It'll take, I believe, a minimum of 60 to 90 days to have the first read, and then more than that afterward. One of the things the United States is doing, which is very interesting, is pre-manufacturing, as it were, a number of different vaccine lines with the expectation that not all of them will be effective, with a very substantial investment in that, with some of which will be sunk costs. And I actually don't know why there isn't a similar type of approach for rapid testing, which is really probably the thing we most need right now. As vaccines go, I think the hope is that there may be a vaccine or two of proven effectiveness by the end of this year. If there is, then I think the most optimistic scenarios that we would, and if there's this pre-manufacturing regime, the most optimistic scenarios that the developed nations might be able to immunize substantial portions of their population by sometime in the spring next year. In the United States and a couple of the other developed countries, that may be a little more difficult because there's quite a strong prevalence, including in our locale, people that are very skeptical about vaccines. And in order to have an effect from a vaccine, you'd have to have what we call functional herd immunity and adequate immunization for that. We also don't know how strong or durable the effect will be, even if there's an effective vaccine. There's a lot of vagaries. I don't think we can hold our breath until then, but so we have to do our best to control and contain until then.
Commissioner Henderson, just would you allow me one word, please?
Yeah.
So everything Dr. Conway say absolutely holds true, and I just want to say that, especially for the benefit of the community, what we do have is a flu vaccine, and it's really, really critical that in September, October, when we get the flu vaccine, that people line up, make time, schedule in, going in and getting the flu vaccine to make sure that we can lessen the complications of this COVID response and the severity of the disease. So that's really an important, I think, message for the community, that the flu vaccine is a critical piece of our COVID response, in fact. And it's important that they heed this advice or input. Thank you.
Well, I'll add that we're very fortunate to have recruited Mr. Sadarazodi into this role, since he's an internationally recognized authority on vaccines and a very prominent vaccine. And I believe that that's a very important stance for us to take in our community. And the flu vaccine, of course, because it's redesigned each year to address each of the prevalent serotypes at the time, typically 3 or 4, is very important for everybody to get, so that reduced illness, and also so that we don't overcrowd our hospitals, which may be quite crowded with COVID.
So I have a question regarding flu. So how many people died last winter, 2019-20, from the flu in the United States? Do we have a number on the flu deaths? Is that something you guys can get back to me with?
There is that number. I don't have it at hand.
Okay. Yeah, I just would.
I think we can produce that. Just to keep in mind that for some reason, traditionally the quantification of flu deaths per year often is, there's different ways of looking at it, but the number that is often stated is influenza. During
influenza-like illness.
During influenza season, basically influenza-like illness related deaths. So sometimes they're not actually due. The attribution to influenza is fairly loose sometimes, unfortunately. So sometimes those numbers are inflated.
Yeah.
Mr. Henderson.
But we are seeing, commissioners, we are seeing excess death due to COVID nationally, and there are some data coming out which they compare it to previous years and what have you, what the expectation would be in terms of deaths, and we're definitely seeing excess numbers driven mainly by COVID. So that's something to keep in mind.
So Dr. Conway, did you want to give us the numbers then from the long-term care facilities?
Sure. I was able to do reconnaissance. Thanks to Heather Keisner for being able to field these questions, our CD manager. I'll go in order that these occurred. We have the first of the additional outbreaks after the large one I discussed earlier, had each of the five I'll talk about, the initial concern was the finding of a single staff member or provider that was infected. The first now has everyone tested back with no additional positives. There is one that has a number of tests still pending that should be available later today. There are two that have each had an infected staff member, and their testing and results are still pending. And then there's that covers it actually. Oh, and
No,
then
there should be one more.
the most recent, same thing, an infected staff member. We're actually still testing, so still gathering the tests, and those results should be available late this week or early next week.
Okay.
Commissioner Adair, we think according to the CDC, also somewhere around 20 to 25,000 estimated flu-related deaths in 2019-2020 season. So in comparison to what we're seeing with COVID is what, 6 times the number of deaths already in the U.S.
Well, yeah, and there's actually one other thing I don't think is talked about as widely as it should be beyond medical circles. So influenza is bad in many ways because it often kills especially elderly and susceptible people, but it's primarily a respiratory disease, and the after effects are primarily respiratory. So people with measles can be more susceptible to respiratory illness for up to a year and a half or 2 years. People who've had the flu typically still have inflammatory changes in their lungs for 6 to 8 weeks after. People who have underlying illness might have that inflammatory change for 3 or 4 months. So it increases the susceptibility to other things. The thing that's becoming increasingly understood about COVID is that this is a disease that affects almost all organ systems. Its effects are protean, meaning across all organ systems, and it's a combination of respiratory disease, general inflammatory disease, and then it also embolic disease where it can cause clots that can cause a lot of downstream damage. And that's one of the reasons why we're seeing substantial numbers of people that have even moderately to very severe COVID end up in either transient or in some cases permanent renal failure. So we're going to end up with many people on dialysis. There are many people that have subtle but detectable both memory loss and the nimbleness of their thought is reduced after the course. And there are many people that have a very protracted and less predictable course of illness, so that you have this very long tail of recovery times. So this is a dangerous disease. This is a really concerning, dangerous disease, well worth avoiding.
Okay, thank you.
And just to follow up on that, I hope that people understand, especially what Nahad said about the way to reopen schools and the way to keep society open is people really have to develop an enthusiasm and commitment to social distancing, masking, and a high level of care. And if we don't do that, especially with the very high incidence in the Sunbelt states right now, and if they don't do that, then we're probably headed toward either very substantial constraints on mobility or very high case numbers and deaths.
Okay.
I was wondering if Tony might have any questions.
Oh, yes. Commissioner DeBone, did you have any questions? I know you're out there.
I am here. I want to just thank our public health staff for this update. I know we are streaming live on Facebook, which means we'll have a little video that will be able to be viewed more easily by other citizens. So hopefully we'll propagate this information out. And once our videos are always available on our website, but we're taking it to the next level with this technical opportunity today. So great discussion. The reality of this situation settles in, understanding just the learning curve and the vaccine opportunities that are coming. It's wonderful to hear the facts as we know them, and that's what people want right now. So All I can say is thank you very much.
Yeah, I'll
Thanks very much, commissioners. We appreciate your support.
One other comment, if we actually have new watchers or whatever, I mean, people should know we're trying to set an example by wearing masks. I mean, only 2 of the 3 commissioners along the bench here, and then also only in our room, we only have 4 people total in our business room here. So that's been anybody watching, that's what we're doing. Try to keep distance and wear masks.
I'll point out that Mr. Sauter-Azzotti and Dr. Foster mask is they're sharing a room. I'm in a room by myself, which is why I'm not.
Great. Thank you very
Thank
much
you.
today for that update. And we will now adjourn until 1 p.m. When we come back for discussions. So thank you for joining us today and this morning, and we'll be back at 1. So thank you.
Thank you, commissioners.
Thank you. So did you watch the doctors from? The meeting of the Deschutes County Commissioners this afternoon session, starting at 1. As of our date, July 29th, 2020. And I want to acknowledge our cameraman who's going to be with us for the last day today. Alex is actually heading off to Chicago for, I believe, a master's program. And I want to thank him so much. You were born in Bend. Yes. So a native Central Oregonian that is going to be leaving for a bigger city. So we wish you all the very best, and we thank you for your assistance with our meetings. It's been really nice to have you, and I hope you like the weather in Chicago. I'm sure it's going to be lovely. And I also want to recognize that I know there was a big write-up in the bulletin about the county fair. Everything got changed last week, and those 300 animals, 250 to 300 animals that are going to be in their Zoom auction, the kids that have spent their summer working on them would greatly appreciate all economic support you can do. You don't have to buy an animal. You can actually just make a contribution to a couple of the participants. So please go online, look at the county fair 4-H auction. It is this Saturday, and whatever you can do would be greatly, greatly appreciated.
And where do people go online to do that? And
Well, I don't have it right in front of me, but I would assume it would be the Deschutes County 4-H. Do we have an actual address anywhere?
Commissioners, I don't have the actual address, but I'm sure there's a link on our Fair and Expo website, or if you went straight to Deschutes County 4-H, there'd likely be a link there as well.
Oh, good.
so
Okay.
they're going to be able to see the animals and then bid on them, like a virtual, like everything else.
Yeah, and I believe that there's a provision, there's arrangements so you can go see it in person this week prior to the auction, but the auction itself will be virtual.
Yes, if you want to see the beef, sheep, pig that you're interested in, or, as I said, you don't have to buy a whole animal, which can be rather pricey, you can make a contribution and support the youth of Deschutes County, and I think that's really a great investment in our future, helping the youth. They need to not only recover their costs, but they're probably trying to save some money for their future education. So if you can do that, that would be great. And thank you so much for considering that. All right, so now we need to talk about the county vacant positions. And I think it might be first important to talk about behavioral health. I know they have a lot of vacancies, and I know they've been under a freeze. And according to the positions that Janice Garceau is advocating for, we have a lot of positions that are grant funded, and I have a list of them that Janice feels like we need to recruit a supervisor, a peer support. Oh, actually, you know, a lot of these positions we actually need to advocate for, follow up for Janice, and you know, so not only do we have vacancies that we don't want to fill, we have vacancies that we honestly do need to fill. So Who would like to, Tom? did you-
Well, Commissioners, all of these are authorized vacant positions, so we're not adding positions. We've been under a hiring freeze since late March, so I've been, as I said last week, pretty firm in only authorizing the filling of positions that I believe are critical to the function of the county. There are others that are certainly very, very important, but that's kind of a fuzzy line. So if the will of the board is to authorize these positions to go forward, that's obviously your choice, and I'm happy to move those. So just in the way of context, it's not that I'm trying to be overly hard on a department or health in this case, just trying to, as best I can, sort of navigate the board's direction in terms of the hiring freeze as well as the vacancy analysis.
Well, and put a little more context on what you're saying, Tom, it was a decision to have a hiring freeze in March or late March, I guess, of any positions that people left the position. We weren't going to hire them right back because we weren't sure of the economics with the COVID-19. And then in the budget meetings in June, what we're doing now is a task to try to identify 1.5% of our overall county employee base that maybe are the least critical if we get into further economic problems, which we're not sure at this point still, because we hear multiple things from our leaders in health about how shut down our economy is going to be. But so we're trying to identify that. I think one of my thoughts, and I'm consistent with Commissioner Dare about if there's positions they need to fill, I think a lot of the grant funding we should fill. A lot of them are limited duration, but I do think because it's such a large department, there ought to be a couple of positions that they could identify that are less necessary, that maybe those would be left unfilled, and they'd be the ones that we have on the freeze on, and we were permanent, and then if the economy comes back, we can look at those like we have in the past with where CDD increased over the last 3 years because there was more and more applications for land use and housing. And that's how I view this, is that if things get better, we can do it. But we do have to be cognizant of the fact that these grants are just that, grants. They're not a scheduled funding stream, so forever. They're just for now. And so
also, just in terms of the sheet, the positions in health that are 100% grant funded are designated and have like a darker orange starting on page 4. There's other positions that are partially grant funded, but we did separate out those that are 100% grant funded.
what's the yellow?
The yellow is positions with new information as compared to last week. So some of those are newly vacant positions or maybe updated information from the department.
Well, and some of those are ones that I have authorized to move forward. I think a good portion of them.
Yes, in fact, on page 5, you'll see the yellow positions are the impacts grant positions that were recently added and have been approved for recruitment.
Okay, I'm looking at Janice's letter, and she has clearly identified 6 positions that she feels needs to go forward. So, do you want me to give you the numbers, and you can tell me about them?
I think I might have the same list.
Do you have the letter? It was written on the 22nd of
Yes,
July.
and both Janice and Kathleen are on the line, too.
Right, I saw her name up there, so I know she is listening. Okay, so she has 2164, the CCBHC Behavioral Health Supervisor, and an CCBHC Aid and Assist Peer. And then we need a Language Access Coordinator, which is number 2735. The peer person was 2737. Supervisor was 2164. Okay, then 3 additional positions are flagged, which are 2046. This is offer currently held on an active candidate, a regular position, and offer letter awaiting approval. So that's number 2046. And then we have Access Team BHS 2, and that number is 2287. It's a regular position, and this fills a vacancy of the only licensed clinical social worker on our Access, which is the intake team. And then the last one, which I believe is incredibly important, is the Veteran Specialist, BHS 2, and that's number 2036. It's a regular position, but it's tied to CCBHC performance. And I think that person had just given, had just retired, resigned from, and so I know we have 14,000 veterans in Deschutes County, so definitely that Veterans Specialist could be important. They work in collaboration with our veteran peers, and they hold responsibility for more than just direct services. They're a liaison to the VA. And that is a revenue-generating position. So those are 6.
Those are 6, but I'm looking at 3 pages of positions.
I know, but Janice,
So what's the connection between this? I mean, it seems like if that's the most needed list, they would be easy to eliminate, and then we'd have 2.5 pages of still positions. What's the connection between our chart and that letter?
these are the positions which Janice advocated for. She realizes we have the financial realities, but these are the positions that she is desperately needing to fill for the overall success of her.
Are they outside the grant fund ones then, or are they?
No, this is CCBHC, that was 1, 2. The Language Access Coordinator, or it's a key position of the CCBHC again. So it seems like all of these are CCBHC expansion grants, impacts, or system of care grants funded positions. So that was the first heading.
The list Commissioner Adair is talking about, those positions are included on our sheets here. They are included. They were just ones that Health is advocating filling now.
Yes, she just said this is what she really needs to run the program. And, we, of course, need to, begin to prepare for perhaps for year-end, next year reductions. But right now, this is an optimal time to be fully staffed and providing key services for many reasons. And she can provide more information if we need it. So,
Well, and I think Commissioner Henderson was kind of going down this path of, would there be any resistance to allowing those positions to be open, recruited for? If they're grant-funded, limited duration, I don't know that they need to be in a pool of positions we're holding off on.
Yeah, I agree with that. I mean, unless somebody tells me something different, Tom, is there some other catch to these that I'm not aware of or we're not aware of?
So, Eric, maybe you could identify by page and location where those
okay.
positions that are requested.
First one was 2164.
Commissioners were given today, just so we can.
Okay, let me find 2164.
It actually has a line through it, reallocate to Beverly, page 4 of 7, it's the last one, reallocated to behavioral health supervisor, new position, so she's, it looks like it's gone to
That's when the board
2762?
approved changing the classification to the supervisor.
Commissioner Adair, you have it correct. It's listed on the vacancy report as, was it 2764?
It's
When
now-
they're reclassified, the position number has to change.
Okay.
So-
So it's now number 2764, according to the.
Oh, sorry, 2762. My font is too small for even
Yeah,
myself.
262. Correct.
Oh, 2762, okay.
Right, 2762, which he said is a supervisor for the Forensic Act team. So do we find that one?
It's on page 5 of 7 on the report, and it's highlighted in yellow because it is, well, it's new because the reclassification went through.
So the note here says it was already approved.
Okay, it has been approved. Do you show that it's been approved, Kathleen?
I do.
Okay, good. Okay, so we've taken care of that one. So then
It
what
was approved on 7/23, sorry, yes.
okay, the day after this letter. Great. So then what about number 2737? What's the status of that?
Also approved, so peer support specialist was also approved on 7/23.
Okay, so now we go to 2735. That's the language access coordinator.
That was also approved on 7/23.
Okay, it looks like Mr. Anderson took care of our needs. Then do we have 2046?
That also says offer approved 723.
723, okay. What about 2287?
Let's see that one.
On page 3.
Oh, yeah.
That's an access team, behavioral specialist 2.
Yeah, so that one I had held.
Okay,
So again, if it's the board's direction that that one go through, happy to do it.
okay, so what is, today's the 29th? All right. And then the last one is 2036. That's the veteran specialist.
That was approved on 723.
Okay, all right. So, Janice, it sounds like we only added one today to your very important letter dated the 22nd, but the others were approved on the 23rd of July. So I would say, Janice, take a look at where you're at now, and then let us know. Unless there's something today, Janice, that you want to bring up.
No, just a clarification that we are going through requests to approve specific vacancies each week. So by the time that you may be looking at this list again, certain vacancies may have been approved in the process, others are still outstanding. So right now in the current paradigm, this is a weekly exercise for us to go through our vacancies and update the list and make the case for those positions as they become available. So again, if there's clarity about grant-funded positions and just being able to move forward with those and set those aside from this weekly approval process, it's certainly for us with a number of grant-funded positions to be filled would be just from a sheer workload and logistics perspective really helpful. And then at some point, maybe moving away from a weekly sort of looking at the vacancies into something a little bit more strategic, I think the department is open to considering.
Well, so as I study this, it looks like a lot of these are already approved, so I'm not sure why they're still on our list. I
So
guess because
Commissioner
they're still
Henderson,
vacant, but they're not filled yet?
Just to be
Yeah, some are approved, and then we also have to get approval to offer. So there's a two-step approval process. We have to get approval to recruit, and then when we've gone through a recruitment, most of the time, not always, but most of the time, we have to get approval to offer a candidate we've selected formally offer the position.
So the
they can
reason
show up.
they're still on this list is that we wanted to be transparent. Since they were on their list before, we wanted to let you know that something has changed, that we've authorized them to move forward. We can take that off after you've seen that, but we just didn't want to have the list that we give you each week have all kinds of different numbers that you're trying to backtrack to. So that's the reason it's still on there, as showing as approved.
So what would be interested in, I'm good if they're all on there because it was a starting list. I'm just saying, so which ones are we still talking about? I mean, if we're already the color coding should be, approved to offer or whatever. And, categories should be like that. So we know what we're still, a lot of these aren't in our realm of our discussion today is what I guess I'm saying.
Yeah, the ones in dark orange are ones that are 100% grant funded, so they would less likely be ones cut by the board. I mean, that's certainly the board's discretion.
But also what I'm hearing is that those are ones that you're okay generally with moving forward.
Do we need a motion for that?
Well, I don't even know all that. I mean, that's what I'm saying. I can't. They're interspersed amongst each other. So the yellow and the orange are two different categories. It looks like the yellows are all grant funded too or something. I mean, approved to recruit.
So
The yellows are newly added to the report.
So it looks like we have 13 grant funded on here, but then some of those we may just have talked about that I haven't marked off.
For clarification, on page 4, you see where the salmon color ends, and then there's a gray bar. It says health grant funded.
Right.
And the very next position is in yellow, but it's part of that orange category of 100% grant funded.
Oh, it is.
So the dark orange 100% grant funded goes from page 4 through page 5.
Okay.
So you're calling orange yellow and orange. Anything yellow and orange is grant funded. Am I right saying that?
Yes.
On page 4 and 5, I mean, yellow in general is just newly added positions. You'll see on page 6, there's a yellow that's a newly vacant position in the elected officials office, in the DA's office.
Okay. So these are yellow and orange. Some of them are yellow and orange, some are just orange, is what you're saying.
Yeah,
Okay.
There are roughly, Commissioners, 25 grant-funded positions that are in some process of either in recruitment or we're required to ask permission to recruit or permission to offer.
So our task that we were given from the budget committee for honoring that is to reduce the, whatever it's called, the hires or the, what do we call it? The 1.5% of what?
vacant positions.
What's that?
1.5 of vacant, 1.5 of the total county positions, but.
Would be eliminated.
Correct.
So to me, the task with health would be to take these salmon colored ones, which now are down to about, 12 or 15, and offer, since there's over 300 employees in the health department, some of those would be what we're kind of after, because other departments have 20 or 30 employees, have already eliminated one. So we'd be looking in this department for some of the least essential as kind of a cushion, and it doesn't make sense that everybody else is working to cut and health isn't. And so I don't know if we've achieved that with health. That's what we're trying to achieve, correct?
You have.
I believe
You have cut 1.7 FTE out of health.
Out of health, 1.7?
FTE, those are listed in green on the first page.
Oh, okay. So we've went 1.7, which out of 300 is, 0.5%. So we would do, 2 or 3 more would be reasonable. If we're just doing across the board things, which is what you do in these kinds of times, that would be what we'd be trying to accomplish.
That's one option. I mean, the board hasn't decided systematically how to go about this, but that is certainly an option of the board.
So I would propose that, because that, you can't take a huge department, not do anything there, and then do it all out of the littler departments. I feel like, and then we've still got the issue of the sheriffs, which is another big department, and whether that seems to take a different approach, but.
Yeah, we can certainly look further. I don't know that health would be able to identify those today, but we could certainly work with them and see if there's a possibility of other positions that could be identified for next time.
And I think for our benefit, commissioners, as we make these decisions, just some clarity either from the commissioners or from Mr. Anderson around, is this indeed expected to be proportionate? And that really helps give us some clarity. I think we were told early on that the expectation was not necessarily that the reductions would be a direct proportion of our FTE, given that both behavioral and public health services are, at least from my perspective, and I may have a clear bias, essential during a pandemic. I think we had hoped that the reduction would not necessarily be proportionate. That said, I think we're willing to go back to the table and look at where there may be some FTE, where there could be some movement. But I do think it would be very helpful for us as a health services department to have clarity on, are we actually expected to be proportionately doing this reduction? And and we have far fewer FTE to work with when we take out of the equation the grant-funded positions.
So we talked about that a little bit, Janice, about the increased need during a pandemic. But you've also shared with us that because you're doing a lot of like the actual counseling sessions that a lot of your employees do are by telephone or whatever, teleconference, that they're actually shorter. So maybe somebody could get in one or two more than they used to when people showed up at your office. So I think the question is both the expanding need and then the time, and you have to make that decision. But that's what I think you should be looking at, is whether there's more need by numbers of people, but it's less time. So how does that work out? And is there?
It's less time by minutes. They just become cumulatively a larger amount because we provide a significant amount of service. So just as a point of clarification. And I think we're talking more broadly, I hope, than just behavioral health. We're a whole department. We have employees outside of behavioral health. So
Well, I'm
I have
talking
to say
about
I'd
Bradley.
be very reluctant.
Because
Yeah.
Are you speaking for the whole health department today, or just?
I'm not, and so it's a little awkward because I think these are decisions I really need to take back to my senior leadership and George and to my cohorts in public health and in our admin services area, and really think through the ask. And I think that's why I'm asking for clarification.
Okay, so I have a question here. If it says approved to open recruitment, does that not mean that she can try and find someone to fulfill that position? I mean, that's what all these yellow ones say.
Yes.
Okay, so we need to have everyone that's open for, we need to maybe sort this a little bit better. So what actually is at the bottom that is out there and they don't have permission to hire them at the moment?
Those are the ones in pink, beginning on.
But no, some of them say offer approved in pink, offer approved. Yeah, a lot of these.
Well, those ones were approved. They're not the 100% grant funded, so that's why they're not in the orange section. That's why they're in the pink section.
You're right. My mistake. So we can certainly, again, if it's the board's will to do as Commissioner Henderson is proposing, then we would have a list of those that aren't grant funded, that aren't already approved, for them to take a look at, plus any other additional vacancies that come up.
Yes, that might be really helpful. What do you think, Commissioner Devon?
I think we need to get real clear on what the ask is. I mean, Commissioner Henderson has ideas about this mandate from the Budget Committee. I don't support that we need to get to 1.5%. I support 1%. So that puts you, Commissioner Dare, in the middle about getting clarity here. It's going to drive the staff and the organization, make us uneasy, referring to us as a service group, all of Deschutes County. If we keep doing this week after week, we got to get real clear on what we're doing here, not just kind of kick it back and forth and ponder over it. And I don't support it in the first place.
Well, thank you very much for that clarification. I do think it's important. I hear the numbers out in private industry and the fact that we have 1,078 plus employees now. What's our number up to now?
I just have the number at the time of budget adoption. It was 1,073 FTEs. Since then, there's been some grant-funded positions that were added by the board.
So do you have that number?
I don't. And I could
Okay.
venture it's about 20, 25.
Oh, I would think so, at least. Okay, all right. Well, it just seems like, I agree with what, I realize this is a health pandemic, but if there was a position somewhere that we didn't need, because we are adding positions where we need them, for contact tracing, et cetera, for pandemic follow through. So that's, Janice, where we're kind of at. But it looks like there's a lot of things that are happening positively for your department. If most of, a lot of these that I see have been approved, there aren't that many. This one says interviewing, so that means it's been approved if they're interviewing. That's like item number 2716. And it does say it's grant funded. What?
Not approved for recruitment, not necessarily for hire. There is a distinction that we've been asked to make. We have to ask permission once we have selected a candidate to offer.
Approved for recruitment. Okay, so what does interviewing mean? That it's been approved?
For recruitment.
No, somebody's, there's a couple that say interviewing. So.
Correct. So it means that there's been approval provided to begin the recruitment, and the stage of the recruitment it's in is interviewing. We've not made any formal offers. Formal offers tend to tie us because they're contingent. So just prior to approving any type of offer, what Janice is referring to is that we are asking for a double check, right? Just checking in to make sure that we still have support to move forward with the position, that we provide an offer letter that ties us to that commitment of that offer before we actually submit the offer. So it is that additional check. So that's what Janice is referring to in terms of a request to recruit for the position, which includes interviewing. And then there's that request to make the offer where we just do one more look. Did we, was it moved? Are we okay to continue with that offer?
Okay, well, if they're grant funded, you're still going to check.
That's our current process.
Okay, that didn't exist prior to the pandemic then, you're saying? Prior to the hiring freeze?
Correct. If it was approved for an offer or approved for recruitment, it would go through the recruitment process, it would be identified, and we would move forward, because there wasn't a concern of there's a timing issue with kind of when this goes to the board versus actions being taken on it. So we just put a pause in the process to ensure that we still have the position and that we're good to go on it.
Yeah, so there were no checks prior to the pandemic, prior to the hiring freeze. If a position was authorized as part of a budget and the department submitted a requisition to fill it, then it went forward.
Okay, so Janice, you're really basically asking to get rid of that pause then?
Well, I guess, I'm going to defer to Tom and to Kathleen, but I would want the commissioners to know that the pause, in particular on the grant-funded positions, it just creates an enormous amount of additional work and tracking. for positions that frankly are grant funded, that we are hiring in a cluster because some of these grants are brand new and there's a number of FTE associated. So if we could at least get permission to just proceed with our normal hiring process on those grant funded positions, I think it would reduce workload, not just for my staff and for myself, but for HR as well, frankly.
Okay.
So that alone would be some breathing room. And then I think, again, I'm willing to go back to my leadership team and have a discussion about FTE. And we would certainly, if we are going to be held to some % reduction, we would want to make a thoughtful decision about where that FTE comes from. Because we have a much clearer sense. I mean, vacancies don't always represent what the real business need is and where the reduction would have the most impact. And I think we'd want the ability to really give that some careful thought.
I know the psychiatrist has been on the unfilled position list for what? How long? Forever?
Well, it's a misrepresentation because it is actually currently filled by several contractors,
right?
Which in fact are more costly than the cost of an FTE. So if we can ever find, and we have a good candidate now.
I thought we did. I heard that.
Yeah, we have a good candidate. We actually save money by filling the position instead of paying expensive contracts for covering it.
So my interpretation was that the issue on the grant-funded positions was that once we approved the grant, then we would approve the hiring of the people related to the grant. So I'm surprised. I've never been on hold about that. I've been on a hold about the things that to me are on a hold are where other jobs that aren't grant-funded are empty, then we're not immediately hiring those without approval. So maybe I misunderstood it, but we've already had the discussions about the grants as a separate issue, so I'm a little bit confused.
Yes, it seems like
It's always been my understanding what we're doing with the grants is, because it was in the paperwork, 8 more here, X number here.
So do we need a motion then in order to
No.
remove the pause? I think we need to remove the pause. I think that would be extremely helpful.
On the
Or grant funded, on the grant funded, yes.
Yeah, you don't need to make a motion. That's clear.
Okay, good.
So for example, each of the grants that you approved the resolutions for last week, the SAMHSA grant, the impacts grant, we immediately authorized those to move forward.
That's what I thought.
Yeah, and so, I mean, what we were trying to do here, because health is complicated and there are different kinds of positions, generally, I've been approving most of the grant-funded positions that come through, not necessarily every single one, but many other positions are partially grant-funded. So there's a multiple funding sources that go towards that position, including, in some cases, some general fund, a portion of that to make up the difference. So those are the ones that I've tended to hold back on, while this process plays out. So, again, I'm trying to interpret the will of the whole board here. I'm not trying to be
Well, I think that's
bureaucratic
the
or
right
hard to them, but,
interpretation from my perspective.
and I hear that.
Yeah, okay, so that's. I
That also.
Okay, great. So Janice, maybe that will help make your life a teeny bit easier.
So Commissioners, what I propose to do after the discussion today, and admittedly, the spreadsheet that you see today has gotten convoluted with all the changes that have come, the authorizations that have been made. So we'll basically create a new one that has only those positions, and I did include all departments, not just health, that have not yet been approved to move forward in the recruitment/offer process. So that's all that's left. It's probably about 2 pages. And for those that aren't grant funded, we would ask health, as we discussed today, to examine those. I'd also ask the other departments to take another hard look at these. Are there any that we don't have to have either right now, or just so we can fulfill the direction of the budget committee and have a thoughtful list in front of you that you can easily see what your choices are in terms of consideration of additional elimination. And to the extent that we can involve the department so we have thorough information clearly on what any consequences related to those position cuts, then that'll be in front of you as well.
Okay. And you'll keep on the front page that has what we've already,
Sure.
the green, keep that in the package.
The
because
10.75.
So we know
Yeah, that's
what
helpful.
we've done so far.
Okay.
Just for clarification, so starting on page 4, all the 100% grant-funded positions, we're going to remove from the list, and those are, health can move forward with recruitment and filling? The orange 100% grant-funded?
That's what I heard.
Just want to make
Yes.
sure that everybody's, okay.
Because I'm sure some of the positions, it'll take time to fill them, so, sounds like an excellent idea.
And we'll remove those from the report for next week.
Okay. So,
Okay, we're making progress.
all right. So I think that's what we needed to do today, and then we'll review it again next week, and that will be in August, so. Thank you very much, Janice. Thank you for your patience.
Thank you.
Thank you, Kathleen. So now we have the Harper Bridge update.
Yeah, Commissioners, I can start this one off. So the reason this is on here, we mentioned it briefly last week. You all received a letter from the Crosswater Homeowners Association expressing some concerns over what is seen now at Harper Bridge, the boat launch on Spring River Road, just south of Sun River, just north of Crosswater. It clearly has been heavily used this summer. Floating is one of the things that families can do and that aren't closed. In other words, related to the pandemic, whether people are all being safe there is another question. But so the Crosswater HOA requested a joint meeting with the Board of Commissioners to discuss those concerns and what options might exist looking forward. So as you all well know, 2 years ago we made improvements to Spring River Road in that area.
It was
and
just
added,
last year. It was March, it finished up July 4th of 19.
okay, well, prior to the
Yes.
last year's rafting season. So with improved identified parking spaces, there was some separation marked on the road with respect to the bike trail where people park, where people are hoped for that they would walk to access the river and so forth. So last year it seemed to go well. This year things are very, very busy this summer, so it may not be as certainly as safe as, not that it's safe, but it was less unsafe than it was in prior years before those improvements were done. We've also seen this summer, more folks, kids, adults jumping off the bridge, which is a separate issue, which we propose to address through a specific ordinance that Dave Doyle has created that we intend to bring to you for consideration that would specifically prohibit bridge jumping in the county. So that will be addressed separately. So really, unless you would like to discuss more extensively the existing situation at Harper Bridge, really the question in front of you is whether you would like us to schedule for you a joint meeting with the Crosswater HOA. And I see both Dave and Chris Doty are on the line and available to answer any questions as well that you might have.
I know, I think it's I think we need to meet with them because they actually help facilitate what we did last year. And I believe we got through last year pretty safely, but with the pandemic and the quarantine and the fact that pools are incredibly restricted on the number of people that can be in them, I hear from people that, there's 1 million people in the water, nobody's wearing a mask, they're all close together, and then we have all this going on at Harper Bridge. I had been texting our sheriff before July 4th because I said, you've got to enforce it. You have to enforce what it's posted. If people are doing it wrong, they need to be getting a ticket. And he he had a, you know, he felt like, well, we could educate, but talking to different officers, they realize now that people aren't really listening, and now they are ticketing. And hopefully, people are going to realize that, no, we have to seriously enforce that.
I see Captain Garrison has
Oh, good.
joined us as well that can speak to that. His name wasn't up there before, so.
Okay, great.
I recognize him from a
Well,
distance.
so before we do that, I mean, I'd like to hear from him, but I want to talk about the problem a little bit more. So I was out there yesterday and drove by originally at 12:45, and all the spots weren't full, but there were a ton of people. There was people sitting by the road, walking down the road, everything. By 2, and this is a Tuesday, so this isn't Saturday. And by the time I came back through, about an hour later, there was all the parking spots were taken. So it's that much more than maybe in the past. I think besides just the crosswater, though, I think, and the sheriff, I really think, originally Sun River was willing to help us somehow or talk about it with us. And so it looks like what we have is an undercapacity here. So we've got to start preventing somebody from being there. And I don't know if it's the recreational services that use it because there's definitely people there waiting to be part of a trip or something. I'm not sure. They were just all kind of piled up there waiting. But, then even Sun River was interested in helping somehow. But it seems like we have more people want to use the river than what we have parking for. And so we need to talk to other options, like shuttle service maybe for the pandemic year, or I don't know, something. So anyway, that's my 2 bits of just thinking about it and seeing it.
Okay.
Maybe Commissioner DeBone has.
Commissioner DeBone, did you want to add anything?
I've definitely had some public input on this topic. People are working through it. They're frustrated. They understand this is a opportunity to do something outdoors. It doesn't even cost money, it's just the transportation and getting the floating device. So it is really popped in our community. We've got other locations that this is happening at also. Little Deschutes River, there's different spots where there's just people walking up and down the road barefoot with their floaties. It's just amazing watching it happen this summer. So we do need to keep that in perspective. But yeah, that Harper Bridge, let's see what we can do. Let's work through this together.
So, Captain Garrison, did you want to bring up your professional opinion for us, please? Is he still on?
His picture's there.
Okay. Oh, do you want to unmute?
Technical difficulties, I guess.
There we go. Thank you.
There we go. How about now?
Excellent.
Okay. No, absolutely. It's a continuing problem. We had over the weekend, I believe we issued, I want to say 19 citations on the various parking problems. But that's in conjunction also with the issue, the foot traffic that we're seeing on the bridge. That's solicited a whole other group of complaints that we've seen that continues to be a problem for us. And I think that obviously Tom mentioned earlier what we've discussed with Mr. Doyle to fix some of that, which I hope that would assist in that matter. But it is an ongoing problem, and the parking, the pictures that I've had delivered to me by some folks that are down there, it does create hazards for us should we have a fire, not only for evacuation purposes, but not just our emergency vehicles, but as well as the fire response units that would be entering into that area to try to respond to contain the fire. So it is an ongoing problem, and it continues to grow. Obviously, I would imagine that with the pandemic, that's probably only increased the matter because people are itching to do something outside. And unfortunately, this is one of the options that's there. I mean, it is a good option, but unfortunately, with that many people, we're just over capacity.
So you did start ticketing what do you know what date you guys started?
I'm not sure. I was not here this weekend, but Lieutenant Bailey advised me of that. And so it could have been as early as Friday, but I've had a number of extra patrols in that area since last week, Wednesday or Thursday.
I don't know. I really feel like because this is a COVID issue in a way, because people definitely want to do something. I would talk to Mr. Munn about it, but this may be what we're having to do there on, a daily basis. I don't know, it might be something that we could actually ask for reimbursement in our COVID. Because
That's a good idea.
people have definitely changed from their quarantine, how they're responding, how they're following direction. It's a bit of a different world out there. We've really noticed, in many cases, a lack of civility. And, so I would talk to Mr. Munn about it, but I really feel that it could be a legitimate COVID expense.
You're talking about the possibility of actually hiring someone or from the department.
Right.
To be out there almost full time from
Right.
10 to 3 or something. Or
Yeah, it's like, I just feel like we have to keep it safe. We've got trucks coming through there. I guess we've got kids still crossing the road again, and now we've got the kids jumping off the bridge. So there's all those things that are happening. And, so I would think that it would be something that we could ask for reimbursement from through our CARES funding.
Paul, do you know what we're talking about, the CARES funding from the state?
Yeah, I'm familiar with that. We're already doing that for some of the other things that we've additionally done during the pandemic.
Okay. That's an interesting point.
Chris, did you want to add anything?
I can add just a couple things in addition to what's been said. We do have signs on the bridge regarding prohibition of jumping, but they're not maybe in the best spot to capture, where the PEDs are entering the bridge. They're more reflective cars driving by per se. So we're going to add more signs to it. Of course, we've had the variable message sign out there for a week plus on reminding folks to park in designated spaces, and then no jumping from the bridge as well. So a couple little things that we are doing to kind of address that one problem, which is kind of, it's not new, but I think it's just becoming very popular now with kids jumping off the bridge. So that, in addition to the ordinance that Dave Doyle's working on, will be a helpful tool to hopefully curb some of that behavior.
We've actually, the ordinance has been approved by both the sheriff's office and the road, so we will be looking at that at a later point. So thank you today for putting that together quickly. And, unfortunately, what those youth are doing is it's rather dangerous, and really we've got to stop it. So,
Commissioners, we can put that on next week's agenda.
perfect. Can we do it on Monday then, or?
Either Monday or Wednesday. You could also, at your discretion, adopt it by emergency, so it goes into effect immediately.
Okay. Oh, good.
Actually, Tom, we need to have a public hearing on that. It's a brand new code provision, so we would need to have 14 days notice. So we could have it teed up for a hearing, whatever that would be, the 12th or whatever of August.
Okay.
I think the value is having that public, public hearing, public notification. It's in the media. We're talking about it. That's probably the punch value of even having that discussion. So I do support that. That's exciting.
Okay, great. So
Given that, one option may be to invite members of the Crosswater HOA to attend that public hearing, so that you can interact with them, converse with them if you like, or you could obviously meet with them down there. That's obviously your choice, but that could be one option to cover off that.
Well, again, I go back to Sun River. I mean, they run a shuttle of their own from right there down to pick up people, and I know that Tom O'Shea's talked to us with us about how he could, whatever they could do to help. It just seems like we had a solution that worked with the population that was using it last year. It was pretty good. Now we've got a doubling or whatever it is, a tripling of people who want to do it because they're not using the Shark, they're not using these other places. This is water to get in, and so it may go back down next year or something. So it seems like it's a 1 year. I just would like to have a couple more players at or the rental places. I remember that a couple of them reached out to us last time we were considering this to be part of the solution because, they kind of advertise that as one of the things you can do doing rentals there. So, I don't know.
We worked with them several years ago. Whitney, if you recall, did a lot of work on this and helped kind of craft the solution. So we surveyed them, we interacted with them,
Right.
we have the names. We're happy to
Oh, yeah.
invite them. I've also been in contact with James Lewis with SROA, and he's willing to participate in either a joint meeting or as part of the public hearing, whatever your will is.
So, inviting them, what date is the soonest date then we can do for the public hearing? Do we have that?
We don't meet on the 10th, so I think the 12th, Wednesday the 12th, if Dave believes that fits within our 14-day requirement for the notice, that would be the proposed day, that Wednesday, which we could kind of put it first on the agenda if you like, so people have a time certain, or 1 o'clock, whatever.
Right.
Whatever.
Is it illegal to walk across the bridge or just jump or fish off it?
I defer to the captain on that one, or Chris.
With that ordinance that Mr. Royal's putting together, it's loitering, essentially. It's not pedestrian isn't an issue, but if you loiter and or make any attempt to jump, push someone else off, that's where the violation enters into it. And it's more expansive than that. And when you read it, I think it makes quite a bit of sense. And it's not just limited to Harper Bridge. It'll be any bridge within the county.
Yeah, there are sidewalks on the bridge.
Okay. All right, and Dave, is the real issue here, we cannot, I know I've heard they want to just completely shut this one down, but I thought legally we cannot shut it down because the community has access to we can't stop the access to the river. And therefore, we really have to do an outstanding job of monitoring the situation.
I think that's a correct statement. And the public has a right in most instances to access, but we can certainly enact provisions specific to our bridges and our infrastructure, and that's what this proposed code amendment would do, code language would do. And August 12th, to answer Tom's question, would be sufficient. We could get that noticed on the county's website this afternoon, so that would suffice for the 14 days.
I believe we could post it no parking, but we couldn't limit someone or prohibit someone from
being dropped off?
the river.
Okay, all right. Okay, well. So we have a plan then?
So that's with respect to Crosswater HOA's request specifically, would be inviting them to the public hearing on August 12th.
Yes.
To your proposal in response. I'm happy to reach back out to them.
It sounds like a good plan. I don't know. Mr. O'Shea just called me, but I didn't answer to see. I know he had let me know that they were very, very upset. So try to stay on top of it. And thank you, Chris, for all your work too down there. We could just have people follow the rules. That would be great. So we're good then for till August 12th.
Commissioner Henderson DeBonne, or is there, you concur?
I agree, and I'm available to communicate with the anybody from the Crosswater Association. You can let them know that I'm available for conversation on that too. And I cross paths with some of them, but just whoever you're talking to specifically.
So the resort was also concerned about the excessive use? Or?
Yes, he knew. He called me 2 nights ago and said they are really furious. And I knew that already because I had been, since before July 4th, really hoping that we would be really monitoring the situation. I just had a feeling with what's happened with our pandemic, how people might be overusing the water. They can only have so many people in the pool, and you can only have so many people here, and, there's no limit there. And then
The river will hold a lot of people.
Right.
It's not, I don't know if they're overusing it. It's not like.
Well, I meant people are all standing there together. All the pictures I was seeing. And then, they're also walking on private property. So do we need to have that posted better, maybe, Chris? Where it says, please, this is, on the other side, a nice sign. This is private property. Yes, I saw those pictures. They're attached here, I think.
Yeah.
Yeah.
Yes.
So the Crosswater Association has their fence there, and there is private property signs scattered. I don't know how prevalent they are right down there at the riverbank where people are kind of crossing over and putting their watercraft on the crosswater side. I would encourage them to probably take a look at how their signage is and how it's being how it's working or not. I haven't heard anything from the resort. I think Mr. O'Shea may have just knowledge of the Crosswater team and the folks, whereas I don't think the resort's indicated any sort of extra dissatisfaction this year with anything that's going on there. Just Crosswater.
Well,
Separately, I have been working with Sun River PD regarding some signage modifications they'd like to make there to inform folks where they can take out once they put in, because there's a few issues with people taking out at Cardinal Bridge on the Sun River side that are causing them problems. So we're working through that separately, but I haven't heard anything regarding the parking situation at Harper's that's causing any concern on the north side of the road.
Right. Okay. Thank you, everyone. We now have other items.
Got several.
Okay.
One is the short report back on the Business Oregon grant program. That was the one that we went out where people could get $2,500 or $5,000 depending on number of employees. I'm part of the Bend and outside Bend area. And although we had requests for all the grant money, we didn't actually have enough people approved to use the grant for that. It's broken down by different regions. So Redmond had a different pot of money, and Sisters had a different pot, and Lapine. And so we were Bend and then all the way down to Sun River. But it was pretty successful. They got quite a few people that have been approved, and we as a committee approved doing those grants to those people. There were some that were still waiting to hear till the end of the yesterday. I haven't heard. They had to get more information in, and then some people that applied were not able to get in. They had a lot of people couldn't get in because of the funding. They'd received federal funding under the CARES Act. But for a lot of smaller, it was targeted to sole proprietors and LLCs and 501c3s. So we may have some additional money for the Bend part of it that we may do a second offering or something to use that up. That was pretty interesting.
See, Sisters had leftover funding too.
Oh, did they?
Yes, and so they sent an email yesterday. Judy had told me that they would probably more than likely have extra money, but we want to keep that money in Deschutes County. And so sent that on to Tom, and I think, are we having Dave look into that? If there's a way that we can really get that money out.
Yeah, I think there probably is a way. Just that, if I could add on that for a moment, we had a discussion on Monday about the CARES Act and the $6.4 million that's been allocated to our county. And Greg and I met this morning. We're going to kind of bring a group together early next week to begin looking at other possibilities. And business assistance, I think economic assistance is going to be a huge part of that. You know, whether it's the existing money that is left over from the grant program or other kinds of assistance that that fits within the language of the law, but, perhaps has less restrictions if we can craft it that way. The other thing that was saw a rundown on yesterday was the GOP proposal for the new package. There's a couple interesting provisions in there. One would extend the deadline on previously authorized CARES Act money beyond December 30th. And there's another provision in there that would allow up to 25% of previously authorized CARES Act funding to go towards lost revenue, so which would come into play potentially in a couple different areas here. So, and then obviously anything additional we can do with respect to direct response with testing or contact tracing, those sorts of things. So those are kind of the pieces we're beginning to we'll begin to put together next week to look at, to ensure or help ensure that we have a plan between now and the end of the year or beyond, if the new legislation passes, to make full use of the CARES Act funding that was allocated towards our county.
So two parts of that. So one is that this Business Oregon money, I saw Judy Trago's email wanting the county to do something, and really COIC did the last group, and they're the ones that led it. I guess they don't have money to staff it, but I'm not sure what, I mean, for us to staff it is a separate thing, but we could, but I don't know whether there was a plan about that, but that money can't be put in some big barrel with other money. It really has to be, all I think we'd do is we'd tell Business Oregon we didn't get enough grant requests that met the standards. We've got X numbers of dollars. Do you care if we do a second application? Because the original money had to be spent by
June 30th, or did they extend that date?
Well, it wasn't June 30th because that was a while ago. It was maybe, it's short.
It was June
45
30th,
days
they
from.
were so late in their.
Well, no, it was 45 days from the day they gave it or something. And I think they may have given it around June 30th. And so maybe it was August. I'd have to check. But anyway, I don't think the timeline's run yet, but we'd have to get an extension from somebody, which would be, I would help do that but that's separate from the CARES Act stuff. Well, I'm glad you have a committee going together. My comment Monday was going to be is we really shouldn't go to the auditors to figure out what to ask for. They're the most conservative group. And so if there's, are you putting together, is it a citizens group, or are you talking about departments, or is it board members? Or?
Well, initially it would just be selected staff people, but we
those are departments, but they aren't necessarily the most knowledgeable about community needs.
Well, right, no, and again, it's not to make any kind of final recommendations, it's to explore really what's on the table. I expect, and Greg and I specifically mentioned this, that we'd likely involve the chambers at some point with respect to business assistance. As we've done in the past, through the work that David Givens has done with the initial program. So we can structure it however the board would like. If you'd like us to set up a more formal committee involving citizens, we can certainly do that as well.
Well, and board members, because we're, at least one or two, we're talking to all the other commissioners about what they're doing in their counties. So there might be some ideas we'd get from there that would be nobody in a given department here might have or something. So that'd be good too.
Certainly.
Good.
Yeah, no, we expect we'll have multiple discussions with you all on different ideas that we might have.
The second thing I was curious about, just under other items, is do we have any knowledge about the motel that we rented for the
23-room motel?
Do we know if it's being used, how many people are using it? Have we had any reports from anybody?
I believe Health does know that information. My understanding, just from what I've heard, is that it is being utilized, but predominantly by neighbor impact for vulnerable population as opposed to COVID positive. But I can certainly ask Health to provide a more in-depth report.
Yeah, I'd like to know if when they say vulnerable population, is that just, how are they using it? Is it just homeless people that they've been able to talk in to go there, or people that have applied for it, or that sort of thing? That'd be interesting. And whether we have anybody we've actually put in it at this point.
Sure.
And then another thing I had was that I did do my interview on the planning commission. I don't know how we're going to go forward on that. I think everybody's talked to the two applicants. I don't know if we're supposed to do that at a board meeting or what.
Or do we do that at executive session?
No, it's not executive session.
Yeah.
Okay, all right,
We can do it later if you want. It's just something.
okay.
So they have those things under other items. Maybe some others have some other.
All right. Mr. DeBonne, do you have any items you want to bring up today?
Nothing today.
Okay. I did write a letter yesterday for Eastern Oregon for OSHA. OSHA did respond to AOC's letter, and they are meeting on Friday. So I wrote a letter after talking with legal for Farm Bureau and Representative Vicki Breeze-Iverson, put together just a soft letter saying that we were aware they were meeting, and we were really hoping that they were going to collaborate more with agricultural interests, because apparently they really hadn't. And anyway, so hopefully that meeting on Friday will be worthwhile. It looked like they were trying to make permanent rules by OSHA without having public hearings, which could be a real problem for people in those industries. So anyway, hopefully that'll get out by tomorrow.
So I guess I do have one item. Yesterday was the Central Oregon Visitors Association, just a board meeting, talking amongst the property operators. And, there's a lot of pride in the industry about the procedures, the policies, the, hand washing and mask wearing in this time of COVID. So just letting you know that, there's folks out there fully engaged and serious about
right now. Can I talk to you
making
later?
sure it's a safe and healthy environment for all of us.
Oh, you're welcome. Okay.
That was just one of the discussions we had at the board meeting yesterday at COBA.
Any discussion about the added pressure for, not allowing tourism, or changing the rules for tourism, or is there fear about that, or?
That was the discussion basically, and I mentioned that we've got our health department, serious horsepower here locally. We're starting to see the numbers, just like our report today, but the decisions have been made at the governor's office most times, so we're not in the spot, other than the short-term rental ban, which we put in place early and then that expires. So, I didn't offer anything as a commissioner yesterday. I was there as, basically listening to the operators. But as I say, their conclusion is, hey, please communicate with us. People, citizens, and, concerned individuals would be generally impressed with how far they go to make sure things are safe. And, but the reality is, of course, we're seeing this. No matter what, there's a lot of emotion out there, one way or another. It was mentioned for a marketing effort. You set a plate of food out on a marketing ad, like on Facebook or Twitter, and there'll be negative comments right now. So we're just in that spot where it's very, no matter what you do, somebody's frustrated.
Were there any concerns there that there might be further restrictions from the governor's office, or?
Oh yeah, that's it. Everybody. Everybody's very alert right now and very proactive and serious. So that's exactly the concept. But yeah, there's a lot of concerns.
Well, she said she was going to issue a travel alert this week, and it didn't happen yesterday, so, and she didn't actually mention it, so we'll see.
So, I have one other thing I wanted to ask you both about. I've been working with Jason Mugar as a proponent of a biofuels. We're working with a company called Biofuels with regard to waste conversion to fuels. And it's a new technology, and they've come out, he's with partners, a company called Biofuels. They're interested in getting involved with our solid waste stream to convert waste, instead of burying it or hauling it somewhere, converting it into carbon through pyrolysis process. And they've got a large engineering company that's involved, and a planner or architect from Seattle. And they're interested in having time to talk to us at a work session about this proposal. Tim has heard the proposal as well, and has been through this before, so he knows some of it. We asked some questions of them. They've answered the questions, but really it's time for you to have a look at this to see if you want to look at it further, or whether we wait or what we do, because they're kind of wanting an answer whether we're interested. So I've only pursued it as far as I felt comfortable, but I really think it's something that you should both look at and see whether it's something you want to consider. And so one possibility would be on Monday's work session. They could give a presentation. They had given the presentation actually to the city of Redmond about a year ago, because they were interested in Redmond's waste, but they didn't really realize, I think, that the county was the solid waste
The king
to this. So now they do, and so they've seen that and seen our solid waste management plan. But would you be in? I mean, I think it'd be worth for you to hear it, because you've heard other ones, and it is something that we're talking about.
So I know I've heard of converting it to like jet fuel.
Yeah, similar process.
Okay, so what are we converting it to?
It's a different carbon product for like a diesel type fuel.
Okay.
So I've got some, experience with these coming to us too. So there's another company out there that is basically kind of pings me every 6 months and says, "Hey, keep us in mind." And we're working on, the big solution, which I think there's always almost works, and then there's some little things in the whole process that make it not financially feasible. So
Yeah.
I'm very much an advocate. I'd love to see it happen. Getting it funded, getting it paying for itself, and figuring out how it all works is always the key to this. So as I say, I'm not opposed to hearing a proposal. Would you really want to schedule it up if we have one, we could have others want to do this real quick, do a presentation just like that. So we've got to maybe think through that a little bit.
Yeah.
Maybe it's not bad. We do it every Monday for a while until people are done talking.
Would you be interested in hearing the proposal?
Of course.
Okay.
Then maybe it would save us from buying another landfill, right?
Yeah, that's
That's the goal.
That's the goal, if we could do it economically.
Well,
Environmentally and economically.
That's been communicating, just made a relationship. So I'll let this other party understand that this is going on, and they might want to come in and tell us what they're doing too. So just making sure there's no resistance to that.
Okay.
Okay. Great. So do you have anything else?
No, that's all I have.
Mr. DeBonne? Nothing else? Okay. All right. Thank you very much. Okay, I do believe now we need to reconvene for our executive session. Alex, so do you want to take care of that for us? please? Okay, so we now do need to bring up the planning commission. Nick, are you available?
I hadn't heard from him, so I'm not sure if he is.
Okay,
If you want him here, we can do this on Monday.
okay.
Or we could, if we get done with one thing, gets back to us, we could do it after that, or?
Right. Okay, let's go ahead then. We are going to, we need to reconvene in executive session then, and you do not have to leave. I don't believe.